Okay. Okay, so Assalamu alaikum. Good evening and welcome everyone to Warnith Suite in Oldham at this great venue for BIMA Northwest Winter Seminar on the title of Islam and Medicine. My name is Amna and I'm a core team member for BIMA Northwest. We are going to begin the seminar with a recitation from the Holy Quran. Please could we ask Qari Jahangir Badr to come to the stage and recite a few verses from the Quran with its translation.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الرحمن علم القرآن خلق الإنسان علمه البيان الشمس والقمر بحسبان والنجم والشجر يسجدان والسماء رفعها ووضع الميزان ألا تطغوا في الميزان وأقيموا الوزن بالقسط ولا تخسروا الميزان والأرض وضعها للأنام فيها فاكهة والنخل ذات الأكمام والحب ذو العصف والريحان فبأي آلاء ربكما تكذبان خلق الإنسان من صلصال كالفخار وخلق الجان من مارج من نار فبأي آلاء ربكما تكذبان رب المشرقين ورب المغربين فبأي آلاء ربكما تكذبان مرج البحرين يلتقيان بينهما برزخ لا يبغيان فبأي آلاء ربكما تكذبان يخرج منهما اللؤلؤ والمرجان فبأي آلاء ربكما تكذبان صدق الله العظيم. In the name of Allah, the most beneficent, the most merciful, the all-merciful taught the Quran. He created man, taught him the mode of expression. The sun and the moon follow a reckoning, and the herbs and the trees do prostrate to him. And the heaven, he raised it high, and he made the balance, that you may not be inordinate in respect of the measure, and keep up the balance with equity, and do not make the measure deficient. And the earth he has set it for living creatures. Therein is fruit, and palms having sheathed clusters, and the grain with its husk and fragrance. Which then of the bounties of your Lord will you deny? He created man from dry clay like earthen vessels, and he created the jinn of a flame of fire. Which then of the bounties of your Lord will you deny? Lord of the east and the Lord of the west, which then of the bounties of your Lord will you deny? He has made the two seas to flow freely, so that they meet together. Between them is a barrier which they cannot pass. Which then of the bounties of your Lord will you deny? There come forth from them pearls, both large and small. Which then of the bounties of your Lord will you deny? Jazakumullah khair.
Jazakallah khair, and thank you for the beautiful recitation. Before we begin today's seminar, we want to go through some basic housekeeping rules. We don't anticipate any fire alarms tonight, so if an alarm does ring, please make your way through the fire exits and assemble at the car park at the assembly points. Toilets for men and women and the wudu areas are along that corridor. We would like to thank our two sponsors for this event, who are Silverdale Solicitors from North Manchester and Communities for All, a community-based group from Manchester. We will have 5 guest speakers today talking about different topics related to Islam and medicine. To ensure that we run on time, we will be taking questions at the end. On each table, you will find blank question cards where you can write down your questions. Please could you raise your hand, and a volunteer will come around and collect the cards and pass it on to our panel lead. Please can we request that all questions are written in legible writing and are kept relevant to the topic of discussion tonight. Any personal questions can be discussed at the end. There will be no questions taken during the seminar. At the end of the seminar, we will have some tea, biscuits, and refreshments, as well as an opportunity to network with other professionals here. This will be followed by our Lifesavers Award presentation, and Isha prayer will be prayed downstairs in Jamaat at 7:20 p.m. We would now like to invite Dr. Waqas Farid, who is the General Secretary of BIMA Northwest. He is a GP trainee from Oldham and has 3 minutes to tell you all about BIMA and its activities. We will also have a stall at the back for more information.
Alhamdulillah Rabbil Alameen, wassalatu wassalamu ala Rasulihil Kareem, wa ala alihi wa sahbihi ajma'in, amma ba'd. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Assalamu alaikum wa rahmatullahi wa barakatuh. So I'm going to speak to you a little bit about BIMA, just a few minutes, just to give you a bit of a background to those who don't know. BIMA was founded on the 22nd of June in 2013 in Leicester. It includes a mixed pool of experienced activists, from senior consultants to GPs to medical students, trainees, and other allied healthcare professionals. And it includes a variety of ethnicities and specialities across the country. Our vision is to unite, inspire, and serve, and we do that, and we have a mission statement, which is to seek the pleasure of Allah through a system of character building, professional development, and service to mankind. And we do this through our 6 priorities that we have, and these are members' education, and that's to promote an understanding and appreciation of the principles and values of Islam and how that relates to the medical profession, healthcare professionals in general. We have some member services that's to support our members, to engage with each other and to help students in their career development, workplace orientation, and social activities. We also do some community service, and that's to promote health awareness. I'll talk a little bit more about that, and also in aspects to Islamic medical ethics. We also have networking and encourage professional and social interaction amongst the Muslim healthcare professionals and the wider medical community in the UK. Ethics, as I discussed as well, is to promote research and education. So we look at things like halal BNF, Islam and medicine, which we're going to focus on today, and history and other aspects of ethics. And finally, relief, which is to engage our professionals using the wide skill sets that we have to be able to get involved in charitable activities locally and globally, irrespective of colour, faith or creed. So just a bit about what Northwest BIMA has been doing over the past year. So we've had multiple events, including basic life support, lifesavers throughout different masjids and centres across the country and the Northwest, where we delivered education to the community on basic life support, and we're going to have a presentation about that at the end of the program. We've also done many health awareness sessions, including talks on asthma, stroke, diabetes, further health fair. We've recently done talks on heart disease, which are ongoing, and in the coming month we'll be focusing on cancer screening. These talks are open to the public, and we try to do them across different mosques and community centres across the region to benefit the public. And seminars like this, we had a previous seminar on the medical aspects of death in February of this year, and we're finishing this year with this seminar on Islam and medicine. So here's some of the posters of some of the talks that we've done through this year, and to get involved, go on the website and become a member. There's regional WhatsApp groups to be involved in, there's national programs and teams, and there's regional core teams. Depending on what speciality you have, what interests you, there's many things to be involved with, and to help your local communities and be involved in these activities. So there's the email address at the bottom there. You can email that to get more information, and go on the website for more information as well. Jazakallahu khair, and that's the end.
Thank you, Dr. Waqas, for that update and brief overview of BIMA. I would now like to invite Dr. Sharif Al-Ghazal to speak about the history of Islamic medicine and the contribution of Muslims to modern-day medicine and healthcare. Dr. Sharif has an interest in the study of the history of Islamic medicine. He is a consultant plastic surgeon and also the vice president of BIMA, and he is also a founding member of the International Society for the History of Islamic Medicine.
Assalamu alaikum. I'm trying to be very quick. I promised Brother Shazad. He gave me 20 minutes, so hopefully we'll run this 60 slides very quickly. I think I've got little... I like to move it. Anyway, I have to stick here because the computer... So, what we really mean by the history of Islamic medicine, it's the knowledge of medicine which was inherited by Muslims in the early centuries of Islamic history. Obviously, during that time, Europe and the rest of civilized nation were in the Dark Ages. And if you can look at just this slide, this is the history of science as being taught by many education systems. And that's why they call it Dark Ages. So they almost feel there's 1,000 years gone missing. Just give you a few examples. One of the big history book they called Short History of Medicine, written by Singer. When they talk about the history of Islamic medicine, they hardly give probably maybe 6 or 7 lines anyway about Al-Zahrawi, Al-Bukasis. 6 lines out of 600 pages. Another book published in Cambridge, The History of Medicine. Again, hardly you get 1 paragraph talking about the history of Islamic medicine. When we go into topics, surgery is very well-known book, Schwartz book of surgery. When they talk about ligation of vessels, they just jump between Galen and Perret, the one is being claimed to invent ligation in the way they know it in the West. And they skip Al-Zahrawi, who discussed it in much more details, almost 500 years before Perret. Al-Zahrawi himself, he mentioned different ways to ligate vessels, for example, and he in fact put it in even more details. You can use non-absorbable stitch, which we call it the silk, he called it eberseam, and the catgut, the absorbable stitch. Probably maybe whoever's actually trained in surgery, they know the catgut, we still use it, and he called it awtarul oud. And this is actually the little manuscript from Al-Zahrawi himself. Again, another example, pulmonary circulation. When it comes to this, most of the historians, they just jump between Gallen, who describe it in a way, we're going to mention it very shortly, and go to Harvey, who claimed that the pulmonary circulation is being discovered by William Harvey, and they forgot or obviously till only recently, that Ibn Nafis, he put it in a very much details, and one of the historians recently, 10 years ago, John West, he gave the credit to Ibn Nafis in quite nice published. So what I'm going to mention now, see how the history of Islamic medicine started. It started by the big movement of translation and the House of Wisdom, Baytul Hikmah, being established in Baghdad by the Abbasi caliphs, Al-Ma'mun, and that time the Arabic language was the language of science on that time, and many translators start preserving the Greek heritage, and without this the Greek copies will be completely lost. But Muslims not only translate, they added lots of different practice. They put the experiments, observation, they put the references as they always taught in Islamic books, classification as well, put it in parts, chapters. They added the pharmacy section never been mentioned, the Greek side. The pharmacy as separate part of medicine. The regulating body, as they call it in Muslim history, Islamic history, is the husba. We're going to mention this as well, and we'll tell you who was the first officer being given this title, husba. Was a lady, obviously. As well, the BIMA stands, which is the hospitals. This has been established by Muslims. Surgical instrument as well. Al-Zahrawi himself, he described over 200 instruments. This is all being added as a contribution by Muslim physicians. I mentioned before, Gallen, as you can see here, he tried to describe how the blood comes from the right side of the heart to the left side, and he thought it's probably maybe like invisible channels. Till Ibn Nafis, he put it very clearly and described the pulmonary circulation. So it's not only in medicine. The Muslims, obviously, they added quite a few advancement in different aspects of science. This talk today, or tonight actually, is just like a little talk on probably maybe bigger, larger talk, but I'm just going to focus only on the attitudes of the Muslim governments, obviously, and mention some few physicians. The attitude of the state, how the state actually look at practicing medicine, probably maybe aware that's one of the princes, Khalid ibn Yazid, he in fact he left his treasure to study medicine in Egypt, and the Abbasi caliphs, as I mentioned before, Al-Ma'mun, he used to give the weight of translated book of gold as a reward to whoever's actually trying to help. Again, Al-Waqf as the trust can be looked after by the state. People can donate money for the sake of building hospitals, treating patients, helping health service, and this is being looked after by the state. And the money of zakah as well can be used, contributed to this. I'm going to mention maybe a few examples on the BIMA stands, the hospitals. Obviously, the first known little medical, as we call it, medical centers, and in the centuries of 700 years, when they used to treat leprosies, and at that time in Europe, leprosy actually being condemned, lepers to be burned to death by decrees. Harun al-Rashid, as I mentioned before, he used to give lots of care to the issue of the health care, and Al-Razi was one of the main famous physician over there. He used to choose the right hospital. He put a few pieces of meat in different sides of Baghdad and see which one the least would be spoiled, so that would be chosen as the site of hospital. It means they've got a fresh air. And so there's over probably maybe 34 medical centers used to be known at that time. And when I say medical centers, I'm going to probably maybe mention one of them. Al-Mansouri Bimaristan, Al-Mansouri in Egypt. This is the largest known so far, which is 8,000 beds. When I put the number 8,000 beds, I mean, I work in West Yorkshire, and the nearest big medical center is actually St. James Hospital in Leeds. Hardly you get 1,000. It's 997 as published in the website in St. James Hospital. So 8,000, this is 8 times bigger than one of the big centers here in Britain. It's got specialized ward, general medicine and surgery, fractures, fever, eye diseases. They've got free admissions, regardless the color of religion or religions. Physicians from all faces, Muslim, Christians, Jews, they all work, serving the same aim. There's medical school attached to this hospital. Students being given free accommodation and pocket money, libraries and housing, and no limit time for inpatient admitted. There's no pressure in that time. I mean, how would they know that the patient is ready to be discharged home? As they say, till the patient is able to eat full chicken. This is amazing way of the healthcare advancement that time. Patients on discharge will be given clothes and pocket money. This can't tell you the level of social service that time. As I said before, the separate ward, male, female. There is very fascinating in Al-Mansouri Hospital, the record of patients. Again, there's mosque, chapels for Christians, and past water supplies when most of Europe, they even struggle to have path, probably maybe once every few weeks, and there's no running water in Europe. So this is actually the level of care in that time. Mansouri was probably around 1,000. An-Nouri Hospital in Damascus, very similar to Al-Mansouri. I'm not going to go into details, just to mention Al-Nouri in Syria, the medical college hospital when Ibn Nafis actually graduated from. Again, Bimaristan Argon, this is quite famous in north of Syria, in Aleppo, and used to treat mainly psychiatry. And this is actually unfortunately, the Argon Hospital in a few years ago, a couple of years ago, after the barrel bombs being thrown on in Aleppo. Again, apart from the hospital system, there's a training system as well, which is being quite regulated. And one of the Abbasi Khalif al-Muqtadir, he ordered Chief Physician Sinan ibn Thabit to screen physicians. So physicians being regulated and given license to practice after passing exams. Al-Razi himself, as a senior physician, he used to take new trainees into anatomy, and after they pass this, and they proceed into clinical side and have the ijaza. So very similar to probably maybe what most of the Royal Colleges they've been doing. And this is what copy of the ijaza, of the license to practice, as we call it. It's interesting to know that the ijaza, the license, has to be authorized by 3 Syrian physicians, as well as 15 well-known, respected people, min wujaha al-qawm, 15 people on the Sahara. Why? Because they need to tell that he is rajulun salih la yuttahamu bi jarima wala khiyana. He's a very well-known, respected person, and there's no conviction against it. And وَكَانَ مُلَازِمًا لِلصَّلَوَاتِ الْخَمْسِ. He's a very well-known to attend all the prayers in Jama'ah in the mosque. Again, otherwise he won't be given the ijazah. I'm going to run very quickly, probably maybe 2 or 3 examples of Muslim physicians anyway. I like to start with Al-Zahrawi, because maybe he was a surgeon, I'm a surgeon, and maybe for obvious reason, he was a Muslim physician. He was born and died in Europe, so he's a European Muslim. I always tell my juniors, be quite proud of such figure. He was here as a European Muslim. Al-Zahrawi called Abul Qasim Al-Zahrawi, so that's why in the West they call him Abul Qasis. Abul Qasis actually because Abul Qasim. He was born in Al-Zahra near Qurtuba, and Qurtuba actually is a beautiful place. Used to be a big library, over 500,000 books, and golden age of Islamic civilization that time in Andalus, when even kings of Europe used to send their daughters and children to study all different sciences in Andalus. And one of them, actually King Offa of England, he even published his currency and written the Shahada, the Kalima, and some historian even question was he Muslim or not. But that's not the issue now here, but just to show you how Muslim being respected that time, the Andalus time. And this is to show you the actual map of Andalus. Patient Al-Zahrawi, he wrote many books. The main book he wrote is actually Al-Tasrif liman ajiza an al-ta'lif. Al-Tasrif means the method of medicine to whom who cannot write a book. It's a huge big book, 30 volumes. The last volume is to do with surgery. Imagine, just the last volume. I'm just going to touch on the last volume and to show you. The last volume actually is 62 chapters. He wrote lots of advancement, and he stressed on some medical instruments. Anatomy, he described many anatomical sites, ophthalmology, anesthesia. He used the opium as well, to the affusion, as anesthesia. Obstetrics, very well known, the forceps for extraction of fetus, of the dead fetus. In general surgery, as I mentioned before, the catgut, absorbable stitch, being used. This is 1,000 years ago. This is 1,000 years ago, 1013. Again, he described the ligation of vessels, as I mentioned before. In this is a short list of the subspecialties he described, he worked. These people almost work as encyclopedia, running life encyclopedia. Ear, nose, he described the tonsillectomy. In a trauma, he described the way to treat even trauma like debrided wounds, fractures, and use the antiseptic in the wound. Plastic surgery, I'm not going to go into detail, but he mentioned the, as we call gynecomastia, which is the enlargement of male breast, and even the cleft. He mentioned the cleft lips. It's very fascinating when you talk about the removing of the as-saratan al-khabis, the sinister tumor or the cancers. He described you should excise some of the normal tissue. So this is to achieve oncology clearance. You have to do wider excision. The book is actually still in Arabic. I mean, quite fascinating book. Neurosurgery, he described the craniotomy, which is still being used as a technique in many of the neurosurgeons till recently. Dental care as well, he mentioned the arch bars as well, and this is the manuscript here, if there's some loose teeth. And some of the instruments he put actually being produced again in Aleppo and in Fas in Morocco. And here he's teaching his student the way of Hijama, bloodletting. And this is actually one of the manuscripts being saved in Oxford University, talking about the extract of teeth, qal'u al-asnan, and he put on the side of the margins as well some practical points, very fascinating. Al-Tasrif is quite a great book. It's been syllabus in many universities in Italy and France for a long time, and he's been considered without no doubt the chief of all surgeons, very famous Muslim surgeons. And this is his book. Al-Tasrif has been translated in many languages as well, English, French and German, as well as in Arabic language. And as I said before, his death been the millennium anniversary of his death in 2013, a few years ago, and there's a big celebration, a big event in India as well. They celebrate Al-Zahrawi. Ibn Sina, probably maybe worth mentioning Ibn Sina, a couple of slides. He wrote the main famous book, Al-Qanun fi al-Tibb, the Canon of Medicine. They say it's over 1 million words in 7 big volumes as well. He was the prince physician, and Al-Razi as well, probably maybe you've heard Al-Razi in Baghdad. He was a chief physician. He wrote a very nice book called Al-Hawi. Al-Hawi is an encyclopedia as well on book. As you can see here, this is like a stained glass window of Al-Razi found in Cambridge University Medical School. And on the side, if you can see, Kitabul Hawi and Bismillah ar-Rahman ar-Rahim. Just Al-Razi also, he wrote few books on pediatrics, on like the switch between small box and chicken box, and also he wrote on food diet. He wrote on ethics of physician, Akhlaq al-Tabib, and he wrote a book for public health, لمن لا يوجد عنده طبيب, the medical guide for public when physician is not available, which is quite interesting. This is a page from Al-Zahawi. There's a few books of Al-Razi, I mean. This is Al-Hawi. And there's a few articles I published a few years ago on different sides. So this is just like a short list of Muslim physicians during that time when Europe was really in dark ages. And some of them, obviously, vast majority Muslim, but some of them like Ibn Ishaq and Ibn Bakhtashur, Christian, and there's some Jews as well, Ibn Rahman and Ibn Maymun. And we shouldn't really forget that there's lots of female health providers, female physicians. One of them actually, Rafida al-Islamiyya. She used to look after Sayyidina Sa'd ibn Mu'az when he was injured in Ghazwat al-Khandaq, in Khandaq battle. And Al-Shifa, this is the lady I mentioned before, Al-Shifa bint Abdullah al-Adawiyya, Sulaym. She called Layla Al-Shifa when Umar ibn al-Khattab radiallahu anhu, he appointed her as in charge for Al-Husba, to regulate the people who deal with the providing all sorts of, as we call it, the pharmaceutical or al-attarin, the drugs or the medicines actually need to be given. So she was very much like health safety officer that time, al-Shifa. And there is Atiyya al-Ansariya as well, during the time of Prophet Muhammad sallallahu alaihi wasallam, famous nurse. Zainab bint Aoud, she practiced as well eye surgery. She used to like treat, you call it al-Ramad, al-Kuhl, and al-Hasan bint al-Qadi, and even al-Zahrawi himself, his daughters and his granddaughters actually used to practice after he died. Why I'm saying this is just, I can see, mashallah, plenty of sisters here. Sisters used to be always on the front when they learn, and not only on the front to learn, even on the other side. They used to teach as well. And one of the very famous, mashallah, it was Maryam al-Fahriya. Maryam al-Fahriya, she was a Muslim female who established the first university in the Islamic world in Morocco, Al-Qarawiyun University. Fascinating university. Why I'm saying this? Because it's only recently when Blackwell actually being registered as American physician to practice in 1858, and Elizabeth Anderson in this country, in Britain, she was denied to practice. She had to go to France to gain license and come back here after the law changes in 1870. Davis Colley in 1911, so it's only 100 years ago, allowed to be the first surgeon registered in the Royal College of Surgeons. So all sisters need to really feel proud of the status of Muslim females in Islam. So obviously we all agree this slide is wrong. There's no missing part. It's actually the history of science and civilization should be taught in a global system this way. 1,000 years actually was probably maybe dark ages in Europe, but was a shining ages in the rest of Muslim world. Education, we need to teach this actually, and it's quite important really. Even pupils in school need to have the positive image of Islam. This is why we try to speak about history of Islamic medicine, and this is very well supported by many even ministers. Why do we need to speak about the history of Islamic medicine? Because trees without strong roots really won't produce good fruits. And I always tell my trainees, only those who remember history can make history. Jazakumullah khair.
Okay, thank you very much, Dr. Al-Ghazal, for that excellent presentation. We would now like to invite Mr. Mohammad Shoiab to talk about the physical and psychological benefits of praying Salah. Mr. Shoiab is an MSK and Pain specialist physiotherapist, as well as a tutor for pain management at undergraduate and postgraduate levels nationally, with many publications.
Assalamu alaikum, everyone. My name is Mohammad Shoiab, and I'm a musculoskeletal and pain specialist physio, currently working within the Bradford Teaching Hospitals in West Yorkshire. I've spent the last 8 years working within the musculoskeletal field, and in the last couple of years begun to move into the field of pain management, in which there are not many physiotherapists working within this field, and in particular not many Muslim physiotherapists within the UK at all. And the work I'm presenting here today is not solely my own. I won't take all the credit for it, but it was developed by the Muslim chaplain within the Bradford Teaching Hospital. Some of you may know, called Muhammad Shoiab. He was one of the first chaplains to become a full-time chaplain at Bradford Teaching Hospitals, and is now the chaplaincy manager for all chaplaincy services across Bradford Teaching Hospitals. Around 10 years ago, he put forward this work alongside one of the physiotherapists called Jill Fletcher, and I'm just kind of moving this work forward from what they started off around 10 years ago. So we all know kind of the spiritual benefits of Salah, so I'm not going to labour that point, because we all know that very well, but specifically Shaz asked me to speak about the physical health benefits of Salah, and there was actually a patient information leaflet that was produced and endorsed by Bradford Teaching Hospitals around 10 years ago, and has won 2 awards that were endorsed by the NHS. So I'm just going to cover the different physical positions of Salah and how this then becomes a manner of exercise, the physical and psychological benefits this brings, and how we can endorse this and promote this to our patients. So as well as the spiritual benefits of Salah, it has been widely recognised that the process of praying promotes many physical and psychological benefits. Each position involved in Salah promotes the different joint movements from a musculoskeletal point of view. Various muscles and joints are stretched. But then looking at that in the context of Western healthcare, it would fall into the realm of physiotherapy. So it actually forms a process of various physical exercises. So although from an Islamic point of view, where from on a spiritual point of view, it also has physical health benefits. And that's where kind of my role within the current role I have within a pain management service came into its own in the last couple of years. Mohammed Arshad here, who's in the photo, demonstrated these prayer positions and produced a leaflet along with the physiotherapy department around 10 years ago. And breaking it down, obviously we have the takbir, and this obviously promotes the lateral rotation of the shoulder. So given in current day in society, when a lot of us spend a lot of time sat at a desk, we are in kind of internal rotation of the shoulders. So that provides a nice good lateral rotation and stretch to the shoulder joint. We're maintaining in Qiyam a neutral position, feet shoulder width apart, and that provides some core stability work and also promotes balance. So for the frail and elderly population, working in this position helps to promote the falls rehabilitation that many patients over the age of 60, 70 may do as part of their falls rehabilitation process, from eyes open to eyes closed. And then going into the ruku position, that promotes the calf muscles being stretched, hamstring muscles, and the lumbar spine. And then when you come back out of ruku into the full upright position, this promotes the extension and the lumbar extension muscles. And I'll touch upon that in a little bit more depth in a second. And then into the sajda position, you are on your hands in front of you. And then as you come back out of the sajda position, you're using your triceps and your scapular muscles. So this promotes thoracic extension. Again, for many patients that spend prolonged periods in a desk-based position, that provides a nice stretch to the thoracic area. And then in the health position, when you are bent on your knees, again, I'll touch upon this in a little bit more depth. This promotes and has shown that through research that repetitive movements in this manner, it improves the knee joint flexion elasticity and at the ankle plantar flexion elasticity of the joint. This has been proven through research that was published earlier this year. So bringing the two together, from the hadith it says in Al-Bukhari, when returning from the ruku until every bone in the vertebra returns to its regular position. So this, from a physical physiotherapy perspective, when we're promoting exercise to patients often lose lumbar flexion, and this can form actually a form of exercise. And in a study that was published earlier this year, which I'll come on to in a second, they found that regular and repetitive ruku movements help to alleviate lower back pain, again, if done in a very graduated manner. And then in the sajda position, the only position in which the heart is at a higher level than the head. This causes a shunting of blood circulation. And from the two studies that were done, they found that the benefits were found in the memory and cognition of patients when they did test pre and post movements. And also another study in 2012 found the alpha brain activity during Muslim prayers has reported increased amplitude in the parietal and occipital regions, suggestive of parasympathetic activity and elevation, thus shedding light on the fact that this helps to increase a state of relaxation. So again, the scientific research is showing that these various positions of namaz, salah, bring about physical benefits. And also the psychological benefits as well. In one of the books written here, Salah is a form that integrates mindfulness because you are in complete focus and the connection between you and Allah. The mental precision because you are memorizing and recalling what you have learned. And then the affirmation because you are repeating 3 times certain verses. And of course, devotion. and stretching, or again, the physical aspects as well. And the namaz, salah brings all this together in one uniform manner. And earlier this year in The Independent, some of you may have seen this article that was published in the British mainstream media and across a lot of the Islamic social media organisations. It was a study published by, again, Aklan 2017, in which they did some computerised modelling of the namaz positions. And this really kind of put Islam in a very positive light, in that the knee joint in the ruku movements, and as you showed that there was benefit to the knee joint elasticity and ankle joint in plantar flexion, and also for lumbar spine flexion. So again, this is a really good study. Again, it's available online, and if anybody wants to access this, they can drop me an email. So in particular, in the bottom, the group found that the bowing portion is the most stressful on the lower back. However, with individuals with lower back pain, using proper knee and back angles during the ritual, it can reduce pain. So this is where we can bring Islam into medical practice, physical practice, and help patients move on long term. So in terms of helping patients, this leaflet was produced a number of years ago and is endorsed by Bradford Teaching Hospitals. And the pictures I showed you earlier on, that forms part of the leaflet and brings into context the reasons for Salah and the physical benefits Salah promotes to Muslim patients, and in particular patients that have various physical ailments with back pain or ankle joint dysfunction, knee joint problems. This leaflet helps to put into context to patients how they can regain that physical mobility again. And this is freely available online on the internet, on the Physiotherapy Pain Association website for free. And a lot of patients, when in the main caseload I deal with, is predominantly Muslim patients, South Asian patients that have long-term pain conditions such as chronic fatigue syndrome, ME, fibromyalgia, chronic low back pain. And a lot of them often state at the outset one of their goals is to try and pray, and that they often feel very low and down about themselves because they can no longer pray in a standing position. And actually, from an Islamic perspective, as we all know, if we're not able to pray in the normal position in standing, Islam says we can pray sitting down. If we can't sit, we can pray laying down. And often patients forget that, and they'll often force themselves to try and stand up and pray. And I often try and, as a way of graded exposure, try and get the patient to start off slowly and build up, so they have the lumbar spine extension again, they develop the knee extension and ankle joint range of movement again. And in terms of bringing the Salah to within UK guidelines, the UK Chief Medical Officer's Guidelines on Physical Activity in 2011 says that patients should be doing around 150 minutes of physical activity of moderate intensity a week. So then if you break down the movements of Salah and add it all up, you're looking at maybe 10 to 20 minutes per prayer time. And that's light to moderate activity. And then if you combine that with what Prophet Muhammad, peace be upon him, said, he who purifies, performs wudu in himself in his house and then walks to the house of Allah for performing obligatory Salah, one step of his will wipe out his sins, another step will elevate his rank in paradise. So here we are, we're bringing what the UK Chief Medical Officer is saying and bringing it together with Salah and Islam, and we're already accumulating those number of minutes to what the recommended physical activity guidelines are. And this is a way kind of I help patients to set goals and try and improve their level of physical activity is, right, well, let's start off with this building block to start with and then build up from there and venture out from there. I think that's all really, and that's all, thank you.
Thank you, Mr. Shoiab, for discussing this important topic and the benefits of Salah physically. Most of us assume the spiritual benefits of Salah, but it's also important to learn about the physical and psychological benefits. I would now like to invite our next speaker, Dr. Naveed Younis, who will speak about fasting as a form of body cleansing and the health benefits of fasting with relevance to diabetes management. Dr. Naveed Younis is a consultant endocrinologist and a specialist in diabetes. He is also an honorary lecturer at the Universities of Manchester and Cardiff and a tutor for undergraduate and postgraduate students in Manchester University.
Assalamu alaikum, brothers and sisters. I'm going to talk to you about the medical benefits of fasting. It's a very large topic, so my 80 slides have had to be cut down drastically. So I'm going to talk just a brief overview, really. I know it's in the afternoon, it's quite late, and I'm sure there's lots of references to the material I have, and I'm welcome to share these slides as well with you. So we all know, or we should all know, about the religious benefits of fasting, and of course we all fast during Ramadan, and we know about the spiritual benefits that we achieve. But of course I'm going to talk a little bit about the science behind fasting, and also whether it's safe to fast for our patients that come to me, certainly with diabetes, but also with other health problems, about the fasting benefits. As you know, when we fast in the month of Ramadan, instead of having 3 meals a day, or 4 or 5 meals a day, whatever you like, we normally stick to 2 meals a day, and we alter our calorific intake, we alter the timing of the meals, we're physically doing much more exercise. So the whole process of Ramadan is changed. Most of us would consume most of our energy levels, or most of our meals in the iftar meal, but actually, and culturally, that's not always the best way of managing our bodies during Ramadan. So I'll just maybe touch upon this today. These are some of the physiological changes during Ramadan. If you look at lots of different studies, and some studies have shown weight gain, some studies have shown weight loss, but actually if you look at a very, a summary of all the studies, most people who fast, these are healthy people, healthy individuals without diabetes, with and without diabetes, 50% maintain their overall body weight. So actually we don't gain weight during Ramadan. And actually, and about 35% actually lose weight, so a significant percentage of patients lose weight. It's about 2 to 4 kilogram loss in weight, so for most of us that's beneficial. And sadly, this reverses after Ramadan, so it goes back to normal. It generally goes back to your own body weight after Ramadan. I'm sure most of us would see this as well. And very interestingly, actually, there's an advantage for men compared to women, because men seem to lose more weight than women during Ramadan as well, and seem to maintain the weight loss after Ramadan than women. So I don't know why that is the case. But typically, the benefits of fasting are clearly on weight loss, and most people who will either stay the same weight or lose some weight during Ramadan. So why do we lose weight? And there's lots of science behind why we lose weight, but when we start fasting during Ramadan, when we start fasting, we start to break down our bodies, and we start to use energies in our liver. We call it glycogen, the storage of liver. And then we start to break down fats. After a while, usually after about a week to 10 days, we start to break down the fats in our body. And this kind of diet is called a ketogenic diet, or it's a low carbohydrate diet, and often leads to weight loss. And this change in our energy levels means that we tend to lose fat, and we tend to maintain the weight loss during Ramadan. The benefits, of course, of losing weight also means that you can potentially also have a beneficial effect on blood pressure, on lowering blood pressure, on lowering cholesterol, and these may have benefits in terms of protecting against heart disease, and certainly protecting against the development of diabetes. We also know that during fasting, even in healthy individuals, that if you fast, we lower our blood sugar levels, because you're not taking as much food, you're taking food very differently, and overall during your fasting, your insulin secretion levels drop to very low levels, and that has a beneficial effect on reducing glucose levels. And I'll tell you here, if most of you are adults, probably 35% of you will have diabetes in this room alone, just because of the ethnicity you have. So most of the benefits, certainly the benefits of fasting will help reduce the risk of diabetes, but also help reduce fasting glucose in somebody who hasn't got diabetes or has got pre-diabetes. A risk factor for developing diabetes certainly will help. And of course, the same can be said about cholesterol. If we look at cholesterol values, most people who fast during Ramadan as healthy individuals will lower their cholesterol values and to benefit, which is beneficial for heart disease in the long term. So during this period of time, there appears to be some good benefits in terms of glucose, cholesterol, and weight during this period of time. And of course, we know about the benefits of fasting, but there are other measures which we can measure. We can measure additives in our bodies, and these can be measured scientifically, so we can measure toxins in our bodies which are abnormally high when we eat the normal diet, and we know very well that some of these levels will go right down during a normal fasting period. So if you measure it before and at the end of Ramadan, we'll find that a lot of toxins are importantly reduced during this period of time during fasting, so showing you the spiritual but also the physical health benefits of fasting in Ramadan. And of course, addictions. There are addictions to lots of things in life, smoking, coffee addictions and cravings. We know that we're more likely to give up and permanently give up coffee, permanently give up a reduction to smoking as well. So you're more likely to maintain stopping these permanently. So if you're a smoker in this room, you're likely to want to stop smoking during the period of Ramadan. You're more likely to stop if you're fasting and Ramadan than you are at other times during the year. And of course, we know certain disease processes. I think we've certainly learned very recently that certain disease processes actually get better during Ramadan. So rheumatoid arthritis, colitis, psoriasis, generalized arthritis actually gets better during Ramadan. Now, this may be due to the spiritual effects, but it's also, if we measure inflammation, if we measure markers of inflammation in the bloodstream and blood tests, actually show beneficial physical benefits of the process of fasting on these disease processes. I've been asked to talk about diabetes and fasting, but unfortunately the topic is a very wide topic. I know there are some risks to my patients with diabetes who fast during Ramadan. So in patients on insulin and certain types of diabetes medication may increase that risk of heart problems during fasting. But we do know very well that for most patients with diabetes, they will benefit from fasting during Ramadan. And nowadays we have lots of newer therapies, a lot of newer treatments that we have that will reduce that risk of fasting, and a lot of education, so that a lot of my patients are educated about fasting in Ramadan that can benefit patients, that we can benefit, and they can alter their medication. Just prior to Ramadan, there's been a lot of work done on this field, and we know that the benefits in terms of cholesterol lowering, weight benefits, lowering sugar levels are magnified in patients, or even greater in patients with diabetes than those without diabetes. So really, fasting, as many years ago we would say to our patients, do not fast in Ramadan if you have diabetes. Actually, now I think the thinking is changing. The thinking is certainly changing for our patients. This is a very useful guideline which is available for all the practical help you might need if you're a physician, if you're a GP or a practitioner who's dealing with patients with diabetes, or if you're a nurse dealing with patients with diabetes, and it's downloadable, free, and it's an expert opinion on people with from diabetologists, diabetes experts, dietitians, on what are the practical recommendation guidelines for diabetes. So this would be a very useful piece of guideline to use. Of course, where I work in my hospital, we're actually looking at the effects of diet on other areas. So the problem is with Ramadan, it's very short-lived, but we're looking at the effects of fasting, intermittent fasting, on other effects such as blood pressure, heart disease, cancers as well. So we don't really know whether there are beneficial effects on these areas, but I think with longer-term support, research, we may find some of the additional benefits of fasting with these areas as well. I'm going to talk about the reality is, though, when people do fast, it's actually very difficult to achieve diet. So most of us have probably gone onto a diet, and at the end of that diet, it's actually very difficult to lose that weight. You go back to the weight that you were. And in the UK, most people who diet, only about 30% can continue to diet and stick to that diet at the end of 12 months. So you have an intention of dieting, but at the end of the year, only 25 to 30% continue to try and continue with that diet. And looking at significant weight loss, so we say generally in science that 5% body weight is significant, and that might not look a lot, it's not a very high figure, but actually that is a significant figure. But in fact, the reality is only 20 to 40% of people achieve that kind of weight loss at 1 year. So actually, weight loss is actually very difficult in diabetes. And at 5 years down the line, if you're on a diet, if you decided to diet, only 5% will achieve that weight loss. So lots of studies have been looked into this. So the benefits of weight loss, the benefits of diet and weight loss may decrease over time. And of course, individuals are now looking into trying to look at beneficial, different ways of fasting. I thought I'd share with you some knowledge about intermittent fasting and the benefits of intermittent fasting. And of course, the Prophet Muhammad, peace be upon him, fasted not only during Ramadan, but actually fasted at other times, and fasted every Monday and every Friday, every Monday and Thursday. So 2 days during the week he would fast, and also on other days of each month. So we know that what are the additional benefits of fasting and this intermittent period of fasting. Well, actually, the scientists have now looked at intermittent energy restriction, and these kind of diets are done. You've probably heard of the diet, the 5+2 diet, where the 5+2 diet is a diet that's been very popularized in the general media. And generally, basically, you eat normally for 5 days, and you reduce your calorific intake to around about 600 calories a day, so 75% reduction for just 2 days of the week. So the rest of the 5 days, you carry on eating what you normally would eat, as healthy as possible. So you reduce by 75% restriction of your diet. So what are the benefits? And I think there is lots of different studies, but I'm just going to highlight maybe just one study. And in this study showed that you lose more weight by doing the intermittent dieting and fasting, and you lose more weight than you do if you try to just reduce calories intake all the way along continually. So I think continual fasting may not be as advantage, whereas intermittent fasting actually might be a much more better way of actually losing weight and keeping off that weight. And we know that intermittent diet restriction has an effect on reducing calorific intake, so calories. It has an effect on reducing insulin, so it has an effect on diabetes and cholesterol values. So perhaps, I think looking back, maybe intermittent fasting will possibly have some benefits in terms of our thoughts about fasting outside the period of Ramadan. And we know other effects: cholesterol, glucose values, liver disease. These are all abnormal metabolic effects which increase the risk of heart disease and diabetes, are beneficial with intermittent fasting or intermittent dieting as well. And certainly weight loss and keeping off that weight loss is much better than it appears than regular daily dieting. And we know that there are benefits, other psychological benefits, depression, mood as well. It also improves during this time. And finally, I was asked, what are the top tips for weight loss? Now, I'm not a dietitian, so I can't say what is the top tips for weight loss. And if I had the answer, I maybe would be lecturing around the world. But I think in general, when I talk to lots of different specialists, lots of different dietitians, lots of different experts around the world, avoid eating the excessive sugar in diet. That's clearly important. And I think it's become very, very important that carbohydrates, particularly the diet that we tend to have in the Western world, tends to put on more calories, because carbs are turned into fats which put on weight. So you need to really think about looking at lowering carbohydrate intake or advising carbohydrate intake for your patients: breads, rice, cereals and things. So thinking about altering these. Using foods which tend to be sustained over time, so using what we call low glycemic index type of foods. So these are foods such as porridge instead of cereals, Cereals tend to push your blood sugar up very high and then tends to come down, whereas porridge tends to keep it very, very flat, with protein as well. So these are the tends to be a better, and also tends to maintain weight loss better. Processed and fatty foods, I think this is just very common sense. And also drinking plenty of fluids, but without sugar or without coffee. These are the things that tend to fill you up better. And there is lots of hadith about the Prophet, peace be upon him, who used to do this as well. And of course, stay active. These are my top tips for looking at weight loss during the period of Ramadan.
Thank you, Dr. Younis, for that excellent presentation. So far, we've had some very interesting presentations, and I'm sure some of you have some questions that you'd like to ask. Please can you write them down on the question cards available at your table and raise your hand for one of our volunteers to collect it from you. I would now like to invite our next speaker, Dr. Rafaqat Rashid, to speak briefly about prophetic medicine remedies which are relevant today. Sheikh Dr. Rashid is a traditional Muslim scholar, GP, and a professional trainer and educator. He is also a senior lecturer at JKN Islamic Institute in Bradford. Sheikh Rashid was taught advanced Islamic disciplines under a number of Muslim scholars and has been issued Ijaza by a number of traditional scholars both nationally and internationally.
الحمد لله نستعينه ونستغفره ونعوذ بالله من شرور أنفسنا من يهده الله فلا مضل له ومن يضلله فلا هادي له ونشهد أن لا إله إلا الله ونشهد أن سيدنا مولانا محمد عبده ورسوله صلى الله تعالى آله وأصحابه وسلم تسليما كثيرا كثيرا سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي Assalamu alaikum wa rahmatullahi wa barakatuh. Now, I'm awaiting my slides. Oh, there we go. Right. Okay, so I am no expert in prophetic medicine, Tib al-Nabawi. However, it's a remit of one of the presentations I'm giving. I have talked about this subject previously once or twice, but not to some detail as would be expected from somebody who was an expert in this area. So at the end of the presentation, please don't come to me expecting me to perform some kind of alternative medical approach to some of the things that are going to be described in here, because I have very little experience in it. I know a few ulama, and I also know certain medical professionals who perform some of these prophetic traditional treatments. One thing that would be very useful to mention regarding this is, before I go into the detail, and it's very relevant, that previously we just talked about diet generally. It's very interesting to see the traditional approach to diet and how diet was seen in the formative Islamic period, even during the Golden Age. And one of the texts that we always make reference to is basically Ibn Qayyim al-Jawziyya, rahimahullah's kitab, on Tib al-Nabawi, and in there he mentions quite a few interesting things about diet. So what I've done is I've just summarized some of the most important parts of that particular kitab and presented it in a couple of slides. And I've got very limited time to do this, so inshallah we'll try to perform a miracle and try to get through this. Now the first point to make, and I suppose what he tends to do is he summarizes this quite uniquely, and he says that physical illness is usually the result of an excess of substances in our body which harm the balanced homeostasis of bodily function. Conventional medicine does recognize the idea of how our diet has an impact on our behavior, not necessarily just our medical or physical state, but also in terms of our behavior. But generally speaking, there was a greater level of emphasis in the formative Islamic period regarding how much diet truly had in terms of its impact on not just you physically, but also mentally as well. So it's quite interesting how that is sort of put together. There are 4 main areas that he sort of emphasizes. They're not sort of emphasizing the wordings that I've used here. I've tried to make it really simple. But generally speaking, there are 4 main areas that he emphasizes. One is excessive eating, which was made reference to in an earlier presentation. And the other is continual eating. So this is basically eating, snacking between meals, and so forth. And there's a very interesting sort of approach. Now, basically, you have to also understand the historical context of such writings when they were actually presented. It was basically at the time of when alchemy was a predominant science, and chemistry has sort of derived from alchemy and sort of developed quite considerably since then. But generally speaking, alchemy was a sort of an approach to the body and medical illness on the basis of humours. Some of you may have heard of it. You know, there's more information you can pick up from the website if you need to. But generally speaking, on that basis, it's an interesting thing to put from this and take from this is how Muslim scientists, historically, what they did was they tried to Islamicize sciences, which is an interesting understanding, really. And there is even a call today by many sort of academics, Muslim academics, that we should Islamicize our sciences, because there is very clearly at the present moment a very Western sort of perspective and direction to all sciences. And we all recognize from the Western perspective, any kind of science that derives from the Western world is devoid of God. And the whole point of some of the traditions and some of the writings, as Dr. Sharif Al-Ghazal has already explained earlier on, was that you'll find that throughout there's a certain theme that falls within all those sciences that were presented earlier on, that there was a presence of theological sort of attitude to science, which we're seriously missing, and it's having a massive spiritual impact on Muslims on that basis. So it's something to really take hold of. I would rather say that what Ibn Qayyim al-Jawziyya has demonstrated here, rather than to take this as conventional medicine, is he's demonstrated how Muslim physicians have Islamicized the knowledge that they understood at that time. And they brought it to fruition and presented it in a very spiritual nature. So, okay, so he mentions excessive eating, he talks about continual eating, he talks about unbalanced meals, where clearly if your meal's not balanced in terms of the right nutrients, that's going to have a negative impact. And he also talks about consuming foods with prolonged digestion, which is an interesting concept, and I think there needs to be a lot more work in this area, even though people are talking about this in terms of how you mix your food. Now, these verses are all over the place, but generally speaking, these verses emphasize some very, very important parts. I'm conscious of the time that I have, so I'm going to try to go through this very quickly. But you get the idea that Allah subhanahu wa ta'ala makes reference, قُلُوا مِن طَيِّبَاتِ مَا رَزَقْنَاكُمْ. So basically, eat from what is pure and good and wholesome that we have provided for you, sustenance. وَلَا تَطْغَوْا فِيهِ, and do not indulge in no excess therein. Then there are also certain hadith of the Prophet sallallahu alaihi wasallam, where the Prophet ﷺ basically said a human being fills no worse vessel than his stomach. So it is sufficient for a human being to eat a few mouthfuls to keep his spine straight, but if he must fill it, then 1/3 of food, 1/3 for drink, and 1/3 for air. Which means that you should eat in moderation. And at that particular time, the Prophet ﷺ was basically emphasizing, do not indulge in your food. That basically indulging in food becomes a problematic health hazard for you. And unfortunately, we live in a society, and with the kind of luxuries and wealth that we have today, we tend to indulge in food. I was reading an article not too long ago where it emphasized that even though we as Muslims in this country are approximately 5%, we actually consume 25% of the meat in this country. So you just sort of, yet when you look historically, at the time of the Prophet sallallahu alaihi wasallam, the Sahaba radiyallahu anhum and the Tabi'un, the generations quite considerably after them, and they were wealthy. They were wealthy generations that came in after the Prophet sallallahu alaihi wasallam. You'll see that meat was not consumed to the extent that we eat today. So, on a relative note, they had more wealth than we have today. but yet they would not consume the level and the amount of meat that we have, or red meat, or whichever kind of meat, as we do today. So some interesting things to ponder over. So the thing about continual eating is more in relation to consuming food before the completion of the digestive process of previous meals. So there was an understanding that when you have something to eat, there are phases in your digestion. So I suppose if I was to relate that to medicine as it is today, there are certain enzymes that are produced to ensure the digestion process goes quite well within the gastric sort of area and so forth, and all the right digestive juices are produced in their little phases. So at that time, the physicians basically believed that when you look at phases, let's say you got phase 1, 2, and 3, and you have the right sort of balance for phase 3, in terms of the right kind of balance of hormone production, the right kind of balance of enzymes and so forth. And then what you do is you consume again and you're starting phase 1. So you're kind of mixing phase 3 with phase 1, and that causes a slight imbalance, and it basically causes, it's interesting how they talk about gastric problems. The gastric problem, I'm a GP, and the amount of times I get people coming to me with gastric problems is just, horrendous. Anyway, something to think about again. So there are many things in terms of etiquettes that Islam talks about. There is the Shama'il Tirmizi, which basically talks, in Tirmizi Sharif is basically a hadith book where it talks about the Prophet ﷺ's eating habits. And some of the things that are mentioned in there is, and the Prophet ﷺ encouraged us to begin eating in the name of Allah subhanahu wa ta'ala, praise Allah subhanahu wa ta'ala, raising the food to one's mouth. So this is an element of spiritually connecting with your food, as well as appreciating and not taking it for granted, which we tend to do a lot of. Also encouraged to eat in company of others. So even the traditional way was to sit with other sort of members of the home, relatives, friends, and so forth, and sit together and eat together rather than eating on your own. And it's like become a customary practice where it's recognized that nowadays people tend to go more to cafes on their own rather than what they used to do when they used to go with somebody else. It's become very popular now. So before they used to go with another colleague or somebody else or a family member, etc. Now they go with their mobile phone. So they sit there in around a table, order their tea and their biscuits and so forth and cake, and then they'll be looking at their mobile phone. So there are certain spiritual sort of components to this that we need to recognize. The other is about not to recline when eating. So the idea would be to sit up straight. So the sort of wisdom behind that is that you're using your muscles, your digestive muscles in terms of your gastric and your intestinal lining and so forth, to help you assist the process of ease of digestion. Also to eat with the first, it's a sunnah to eat with the first three fingers of the right hand. There's a certain practice, Ibn Qayyim al-Jawziyah mentions this. And basically the idea behind that is that you're eating in small proportions as well, and you're not sort of shoving big spoons of food in your mouth, continuing one after the other. And also to thoroughly chew the food before swallowing, because clearly we have, our saliva contains certain digestive enzymes which allow the initial few processes of the food to be digested before it actually goes down into the stomach. Then there's something about unbalanced meal. So consumption of food which is not balanced and deficient in nutrients. So ya ayyuhan nas kulu mimma fil ardi halalan tayyiba. Yeah. So basically here the verse of the Quran says that you should eat not just food which is halal, but also which is pure. And you'll find that even if you look in the kitabs of tafsir, they talk about purity in terms of wholesome food that is basically what we would describe today as organic. And our ancestors used to eat organic food, and they didn't call it organic because that was the normal food of that day. But today, we've started giving it a label of organic food because our food is not organic. We have all sorts of wonderful chemicals mixed in our food. So that must have some element of impact in terms of our diet and possibly even contribute to a number of different things. You'll find many sort of people who are involved in alternative medicine. They talk about how certain hypersensitivity conditions are increasing more so, such as asthma and eczema and hypersensitivity sort of general syndromes. And they sort of link it with the idea that we consume many sort of chemical products when we eat, things that we consider as daily sort of intake. Then we have a number of hadith which basically relate to consuming food with prolonged digestion. So basically what this is really emphasizing, so the Prophet ﷺ was very conscious of how he mixed his food. So here there are a couple of examples where mixing unripe dates and dried dates, mixing raisins and dried dates, and there's also an instance where he used to eat melon with fresh dates, and he used to say the heat of the one is broken by the coolness of the other. And that's a kind of a way of describing it. But generally speaking, there is something about the acidity of certain food, the alkalinity of certain food, and you'll find there are many different sort of approaches to diet which are not conventional, but they have a slightly different approach to it. And they even talk about this to some extent in terms of how we should ensure that our diet is balanced. And our balancing is in making sure that we've got the right kind of number of nutrients in each kind, protein and vitamins and so forth. Okay, so moving on to the next thing, cupping, hijama. Okay, so I'm just going to very quickly brief over a couple of things. I've got a few minutes, so I'll talk a bit about hijama, I'll talk about its spiritual benefits, its physical benefits, just give you a bit of an idea about the procedure and the best times to have hijama done and areas of the body. Just out of interest, how many people have had hijama done? Okay, so yeah, about maybe a third, less than a third. Okay. It's an interesting practice because hijama is not specific just to the Muslims. Historically, hijama has come from China, it's come from various other places. So it's a kind of a practice in terms of therapy from a number of different sort of traditions. But anyway, but the word comes from hajm. Hajm basically means to suck, and that's what you're doing. You're sort of forming a vacuum so that you can actually suck up the blood to the surface near the skin. So technically it refers to extracting the blood, and usually so the main place is usually the nape of the neck, and that's what you do is you can actually incise that area of the skin and withdraw the blood there. Okay. And this was practiced in ancient times by Egyptians, Chinese, by Greeks, and so forth. Now, the form of treatment which grew from the humoral medicines, and I was talking about alchemy earlier on, related to the balance of the four humors of the body. So it's basically, the body was described in terms of blood, phlegm, yellow bile, and black bile as different aspects to the human body. And the concept of hijama arose as a conjunct to that. And I think the best way for us to really understand that is that there is some element of therapeutic sort of outcome when you withdraw certain elements of blood from certain places of the body. Now, there is no true medical rational reason to think like that, and the same could be said about acupuncture. And acupuncture has become quite a very popular practice today, though it's not very well understood how it works. In a similar kind of way, hijama has had its impact in many different regions of the world. So there was a kind of a surge during the 18th to 19th century Europe, and in certain parts of Europe, and then that sort of slowly, gradually diminished. And it wasn't because of lack of research or anything, but generally speaking, I think just the practice started diminishing because it became more and more known that Muslims were performing this, and that probably had a bit of a negative impact on the practice in Europe. So there are spiritual benefits in hijama, so you should always think of hijama as not just something which has physical benefits, but also spiritual benefits. And there are many sort of hadith, I've just mentioned one or two here, basically where there's a hadith of Jabir ibn Abdullah, where he said basically to the Messenger of Allah sallallahu alaihi wasallam, if there is anything good in the medicines that you treat yourselves with, then this good is in the incision of the cuppa or a drink of honey or cauterization with fire, but I do not like to be cauterized. That isn't to say that cauterization is not the right thing to do. The Prophet sallallahu alaihi wasallam preferred the other alternatives to this. However, we use cauterization very differently today to what it was used at that particular time, so don't mistake and misunderstand. So then on the night of Isra, basically the Messenger of Allah sallallahu alaihi wasallam did not pass an angel except that the angel said to him, O Muhammad sallallahu alaihi wasallam, or your ummah with hijama. So here there was a clear emphasis. And it's interesting when you look at some of these hadith, some of the muhaddithun, in terms of some of the commentaries regarding these hadith, they talk about the concept that to actually seek treatment was a sunnah of the Prophet sallallahu alaihi wasallam. It's a really interesting thing. And I would personally say, and I remember reading an academic article some time ago, and I can't really remember who actually wrote this, but what they were trying to emphasize was they were trying to make the point, and the issue was it Islam that brought on the intellectual sort of development in the golden age of the Muslims, or was it just the fact that it just happened that they became more flooded with wealth, and they started developing those sciences? And he was emphasizing the point that specifically medicine, it was Islam that really sent it on a trajectory because at that time you had Muslim scholars who were physicians. It was very common to have a Muslim scholar, a traditional Muslim scholar, who was also a physician. So it was an interesting point to pick up. So cupping as therapy, cupping can be used for a number of different reasons. So cupping can also cure and heal physical ailments. So the Prophet sallallahu alaihi wasallam used to use. He's mentioned a couple of things related to this. This slide really emphasizes some of those. The best medicine to treat oneself with is cupping, or it is the one of the best. Okay, and also if there is anything good to be used as a remedy, then it is cupping, hijama. Now, also remember that if you look at this from a very technical and conventional sort of way, at that time, cupping was quite a popular way of therapy. And there are now many other popular ways of therapy, so this isn't to negate any other forms of therapy. And I do get sometimes patients. I had a patient who had cancer not too long ago. Unfortunately, he's passed away now. And I remember one time when he was actually saying to me that, he doesn't want to take chemotherapy, but he's basically decided he wants to have cupping done. So I said, alhamdulillah, that's fine. You can have cupping done, but also take up other means. Don't just rely on just the one. Now, there are certain benefits of cupping that Ibn Qayyim Jawziyya rahimahullah explains in his Zad al-Ma'ad, in his kitab, and he talks about the fact that it has benefits on the circulatory diseases and high blood pressure, on headaches, pains, and I've just presented some of the evidences of some hadith in relation to each one. Pain in the neck, stomach, rheumatic pain in the muscles, pain in joints, and also black magic. So sihr as well. There are certain procedures that are used in cupping. So there is dry cupping. Dry cupping, in essence, all you're really doing is you're just using a vacuum, sucking up and pushing up the skin through the vacuum, and then also the blood collects underneath, and that's all you're really doing. Dry massaging is when you place zaytun, olive oil, and wet cupping is where you actually put a little incision and withdraw blood. And there are best times of cupping. Generally speaking, what these hadith are really explaining, that the best time to cup is generally on Thursday being the best, and Monday and Tuesday, avoiding Wednesday, Friday, Saturday, Sunday. So basically, Thursday is the best, and then Monday and Tuesday. Then Anas ibn Malik narrates that the Prophet sallallahu alaihi wasallam basically said, whoever performs cupping on the 17th, the 19th, and the 21st day, then he said basically then it is a cure for every disease. So there are certain hadith which relate to the dates as well. The cupping can be done in a number of different places. These are just some examples where cupping can be performed. So it can be performed at the side and the base of the neck. There's clear evidence of hadith that suggests that. The Prophet ﷺ had it done on his head. Also, you can have it done on his hips, top of his foot. Top of the foot occurred when he actually broke the bones of his foot, as it states in the hadith, and after a traumatic incident. And he also actually had a cupping done of the foot as well. Just a few final points before we finish, and I'm spot on with time. Okay, that basically practice slowly declined with time, and there seems to be sort of an increase of the practice now. We're finding a number of people sort of popping up in different cities who are claiming themselves to be people who can cook, and also they're getting quite popular. But unfortunately, it has been done in a quite non-professional capacity. I think that's slowly, gradually changing now. So I think we also have I think it's the Islamic Cupping Society, I think, or Association of Muslim Cuppers or something like that. I think that there are a few organizations that are starting where you've got medical professionals actually performing the procedure as well. But in terms of evidence, I think the only thing that really has been out there is where there's been some studies that have been done in China on the practice of cupping in a professional capacity, and it's actually shown some good results. But we all recognize that when it comes to especially alternative therapies, that it all depends on how well it's funded. And if you have any kind of therapy which requires you not to use means where medicine is used, then clearly that will not be funded very well. So clearly there's a real need to have things like this funded well, and then to really get some serious evidence there. Randomized controlled trials would be a very useful way to demonstrate how effective cupping really is. So hijama, as was practiced at the time of the Prophet ﷺ, is spiritually and physically beneficial, so it has both benefits. And just a word of caution, seek a well-trained cupper, with experience, ideally one who is a practicing Muslim. And this is quite important because there's a spiritual journey for you to have. It is quite different. They read certain supplications, certain dua when they cup, and they have a certain traditional approach to it. And a lot of them are very good. I've been cupped, and they're very good in terms of their professional attitude and how they basically ensure that things are done in a safe, healthy way. So inshallah, I'll finish on that note, and I think you're going to end up seeing me again in a short while, inshallah. So jazakumullah khair. Assalamu alaikum wa rahmatullah.
Thank you, Dr. Rashid, for that concise and excellent summary of this vast and very important topic. I would now like to invite Dr. Riza Mohammed to come and speak about the Quran as a cure for depression, specifically looking at Surah Ad-Duha. Dr. Mohammed is a trauma and orthopedic surgeon, as well as a founding and current executive member of the European Academy of Quranic Studies. He is also an educator, curriculum developer, and khatib at community and university mosques.
Assalamu alaikum wa rahmatullah. While we wait on the slides, I'd like to acknowledge many of the students who learn Arabic here at this center, the European Islamic Center, who have been partly responsible for putting together this presentation. I teach Quranic Arabic here on Saturdays at this center, and it's one of the things I think that all Muslims should be engaged in. It's really an important science in terms of us trying to become closer to Allah subhanahu wa ta'ala, and more so to the word of Allah subhanahu wa ta'ala. And as we would see from this session, inshallah, over the next few minutes, how important it is for us to be able to understand what Allah subhanahu wa ta'ala says from its original text. Now, the topic itself is called Spiritual Healing, the case study of Surah Ad-Duha. And we know that we live in a time, and if we think about the Ummah, the Muslim world at large, that right now we are undergoing a great depression in more ways than one. And the recent announcements have made it any better. But not only is there depression at a global level, but there's also a great level of depression among individual Muslims. Even as believers, each one of us goes through periods in our lives when things just don't go the way that we would like them to go. And sometimes we need to be able to re-engage, to be re-energized. And the Quran holds in it so much that we can use to our betterment, inshallah. And in this presentation, we'll be looking at Surah Duha. Now, Allah subhanahu wa ta'ala describes himself in the Quran as a Shafi, the one who heals. And really, if we think about it, Allah subhanahu wa ta'ala being our creator, He is one who wants to heal. And we know that we all succumb to ailments. We all succumb to diseases. Whether they be physical diseases or psychological, mental ailments, we all do. And so in those times is also an opportunity for us to be able to turn to Allah subhanahu wa ta'ala and to come closer to Him. Sometimes when we seem to have everything at our disposal, we know where the next meal is going to come from. We know where we will sleep and have a comfortable rest at night. We know where our children are during the course of the day. We have all the means at our disposal, all the comforts, all the wants that we want, all the gadgets around us. It's very easy for us to turn a blind eye to the one who is providing everything that we have. And sometimes we need to turn to Allah subhanahu wa ta'ala. Now, I did check this presentation before, so I would like to say that the Arabic font is not the way it ought to. This is not a different Arabic script from amongst the Arabic scripts but basically in this ayah of the Quran, Allah subhanahu wa ta'ala tells us that He has sent down the Quran, which is a shifa and a rahmah lil mu'mineen, to the believers. So here again in the Quran, Allah subhanahu wa ta'ala is saying, as ash-shafi, the one who heals, He is sending a shifa. So the Quran is a shifa. And the word shifa is also added to the word shifa, the word rahmah, or the word mercy. So while we wait for the remaining slides, inshallah. Okay. So this second ayah of the Quran, again where Allah subhanahu wa ta'ala is talking to Rasulullah sallallahu alaihi wasallam, and He's telling to say that huwa lilladhina amanu hudan wa shifa, that this is a guidance and a healing for the believers. So again, the word means it is a guidance, it is a huda, and it is a shifa. Again, Allah subhanahu wa ta'ala says in this ayah, Ya ayyuhan nas, qad ja'atkum maw'idhatun min rabbikum wa shifa lima fi sudur wa hudan wa rahma lil mu'minin. Again, it's a healing, a guidance, and a mercy to the believers. So again, we've seen the same theme repeated. And the combination of a huda, it is a guidance, it is a rahma, and it is a shifa. If we look at this particular ayah of the Quran from Surah Nahl, we see here Allah subhanahu wa ta'ala is talking about it, about the Quran, not just as a shifa, as a healing for psychological ailments, but also as a healing for physical ailments. In this case, we're looking at the bees and what they can provide in terms of providing some form of benefit. يَخْرُجُ مِن بُطُونِهَا شَرَابٌ مُخْتَلِفٌ أَلْوَانُهُ فِيهِ شِفَاءٌ لِلنَّاسِ إِنَّ فِي ذَلِكَ لَآيَاتًا لِقَوْمٍ يَتَفَكَّرُونَ. Allah subhanahu wa ta'ala is telling us about the bees and what they can provide in terms of being able to provide some form of a cure for physical diseases. And then it's talking about this is something for those people who reflect, يَتَفَكَّرُونَ. And this is an important part of the Quran. The Quran is just merely a book which is meant to be read. But the Quran is a book which is meant to be reflected upon and to be able to draw lessons from. And again, in this ayah of the Quran, Ibrahim alayhi salatu wasalam, he says, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينَ. And whenever I am sick, He is the one who heals me, Allah subhanahu wa ta'ala. And I want to ask each one of you a question. The last time you fell for the flu or you had some form of an ailment, and then you got better, did you think about Allah subhanahu wa ta'ala? Did you think about Him being the one who brought some form of cure to your ailment? You know, very often when we get sick and when we get the flu and when we are down and when we can't go to work, it becomes difficult for us. And sometimes we rarely down and we think that when is this going to end, especially if it goes on days after day. And this is something for us to be able to reflect on, that when things happen to us, we need to turn to Allah subhanahu wa ta'ala. Now coming to the surah at hand. So this surah is Surah Duha. It is in the last juz. It is one of the shortest surahs of the Quran. It is one that I'm sure that most of you would have memorized by heart. And we want to look into this particular surah of the Quran and look at some of its linguistic features and look at how it can be used to be able to help us as individuals, as human beings, because we know that it is about Rasulullah sallallahu alaihi wasallam and his encounter, about his own predicament and his situation, but it is also one that talks about what us as human beings can learn from this. So a summary of the background to this particular surah of the Quran is that this surah was revealed during the early Meccan period. As we know, the Prophet Muhammad sallallahu alaihi wasallam received the first revelation at the age of 40, and during the first 13 years of prophethood, this was time spent in Mecca. It was a difficult time. He was trying his best to spread the message. Only a handful of people accepted the message. Amongst those who accepted the messages of Islam, who came to Islam, were the poor. They were the destitute. They were slaves. They were former slaves. And many of them themselves were in slavery. So you had a small band of people who, in a sense, were defenseless coming to the deen. And there was great opposition to the message, not just in the form of words, but also in the form of actual physical violence, to the extent that some of the Sahaba died. Some of them were killed. The first martyr for the cause of Islam was a Muslim woman. Her name was Sumayya, and she died at the hands for declaring her faith, of being called a Muslim, of daring to say La ilaha illallah, Muhammad Rasulullah. It was a difficult time, but the revelation was coming from Allah subhanahu wa ta'ala until there was a period when the revelation seemed to have stopped. When the Prophet Muhammad sallallahu alaihi wasallam expected the revelation, it didn't come. And so there were many amongst the Quraysh, among his enemies, who were looking at him now, including amongst those was Jamil, his own aunt. And she looked at him and she said that, your Lord has abandoned you. He's not happy with you. He has despised you. These were her words. So it was difficult for him. And then he saw those who were close to him dying as well. And there was nothing he can do. He tried to reach out among some of the best amongst the Quraysh, but they did not want to listen to the message. It was a difficult time. And then this surah of the Quran was revealed. And it started with the words, وَالضُّحَى. Soft words. Words which are meant for a tranquil heart. This heart of Rasulullah sallallahu alaihi wasallam was racing. It was terrified. It was in the state, almost a state of despair. And then these calm, comforting words come. Allah subhanahu wa ta'ala says, by the glorious light or day. And this is not just any light during the course of the day. The word duha is a special word in the Arabic language. It has that sense of meaning of light which is warm. Light which, there can be heat. You can see the sunlight at times. And if you are in the desert and it's midday, you can imagine what it's going to be like with the intense heat which is befalling you. But this is not the intense light which comes with the sun at midday. This is a light which is warm, which comes in the early part of the day, which brings a sense of calm over you. And these are the words that Allah subhanahu wa ta'ala is using. So, وَالضُّحَى وَاللَّيْلِ إِذَا سَجَى. And notice here, At the end of each ayah is what is known as one of the literary features of the Quran, which is called the assonance of the Quran. Assonance has to do with the sound and the way the words are put together and the way the words are related. And you notice here, and I have highlighted at the end of each ayah, the first few ayat, that the alif maksura has been used, which is the ya. All of them has the same alif maksura. And that in itself, when it's recited, gives you a sense of peace, of calm, of warmth, which comes with it. So, وَالضُّحَى وَاللَّيْلِ إِذَا سَجَى. So you may have had a difficult day. You may be even having a difficult night. But there is a tranquil part of the night which is yet to come. So this is not just the busy night we're talking about. We are talking about the night when there is tranquility. The night when all those other noises that are affecting you suddenly comes to an end. They can no longer be heard. And now you can turn your attention to something which is within. You can turn to trying to redeem yourself of what you're undergoing. مَا وَدَّعَكَ رَبُّكَ وَمَا قَلَى. Your Lord has not forsaken you, nor does he despise. Now I have put you into brackets because Allah subhanahu wa ta'ala did not put in the ayah of the Quran, مَا وَدَّعَكَ رَبُّكَ وَمَا قَلَاكَ. He did not put the ka at the end. Just to be able to ensure that when the word despise was being used, it is not being used in a sense of being connected in any way with Rasulullah sallallahu alaihi wasallam. And here it is that Ash-Shafi, the one who heals, he is suddenly now understanding what the turmoil is in the mind of the person who he's trying to heal. In this case, Rasulullah sallallahu alaihi wasallam. He knows that Rasulullah sallallahu alaihi wasallam is thinking, maybe my Lord has abandoned me. Maybe he has forsaken me. Maybe the revelations will not come again. But Allah is saying, no, he understands what's happening. And I have not despised you. Be assured. Words of reassurance. وَلَلْآخِرَةُ خَيْرٌ لَكَ مِنَ الْأُولَى. And imagine this. You have just heard some bad news. Someone has called and told you some really terrible things has happened. And at that moment, what do you think? You think the worst has suddenly dawned upon me. There can be nothing worse than it. وَلَلْآخِرَةُ خَيْرٌ لَكَ مِنَ الْأُولَى. Know that no matter what you have heard now, no matter how bad it is, how horrible it might seem, know that tomorrow will bring something better than today. The future is bright. Always be optimistic. Think about it. And this is the last time, this is the last thing you would want to think about the future. But Allah is telling you, do not ponder. Do not become preoccupied with your present state. Think about what is to come next. And be reassured that the future holds something which is bright. وَلَسَوْفَ يُعْطِيكَ رَبُّكَ فَتَرْضَى. And your sustainer will surely give you, and you will be pleased. We know that you are not pleased now. We know that you're concerned and you're worried and you're in a state of despair now. There is no pleasure to be had. The food that you consume, even though it seems to be the best food which is in front of you, seems to be food that just tastes ordinary. But know that the future holds something which you will get if you remain steadfast. And then Allah subhanahu wa ta'ala changes. After this reassuring word, he suddenly says, Alam yajidaka yatiman fa'awa. Allah is asking Rasulullah sallallahu alaihi wasallam to become reflective now. Become reflective. We talk about cognitive behavioral therapy. This is what is happening here. Allah subhanahu wa ta'ala is saying, reflect upon your own condition, your own journey of life, what you have been through. Don't you remember the time that even before you were born, your dad had died, your father had passed away? And when you were young, you were placed into the hands of Halima. And even then, when you were merely a child, your mother died. And then you were placed into the care. Allah subhanahu wa ta'ala found someone in the care of your grandfather who treated you just like your father. And then when he died, he placed you into the hands of Abu Talib. And he treated you the same way your grandfather did. And when it is that you were in need, Allah subhanahu wa ta'ala found a way to be able to provide what you needed. When you were short of income, Allah subhanahu wa ta'ala provided you with someone to take care of you, to provide everything that you wanted, to provide advice, to provide comfort, and to provide even material resources in your wife Khadija radiallahu anha. Khadija, who was the bedrock of our deen. Without Khadija, we would not have someone who would have stood up when the message came from Allah subhanahu wa ta'ala. When Rasulullah sallallahu alaihi wasallam received that first message, what did he do? He was terrified, to the point some of the hadith says that he wished that he was not even alive at that state. But he rushed home to where? To his bed. He rushed straight into the arms of Khadija. Khadija radiallahu anha was the one who reassured him who he was, the type of caliber of person he was, the character which he had. And Khadija was able to reassure him. وَوَجَدَكَ عَائِلًا فَأَغْنَى. And he found you wandering, he found you needy and enriched you. فَأَمَّا الْيَتِيمَ فَلَا تَقْهَرْ. And now there is a change. Notice I said we talked about the usage of alif maksura at the beginning, few ayat. Now suddenly the tone of the surah is changing. Why is it changing? The tone of the surah is changing because now it's action time. Now you have reflected upon what Allah subhanahu wa ta'ala has given you. Now you understand your condition. Now it's not just about remaining silent or not doing anything or being in a state of self-pity. Now it's about putting into place an action plan that will be able to get you from your current state into the state that you wish to become or to be in. فَأَمَّا الْيَتِيمَ فَلَا تَقْهَرْ. So as for the orphan, do not, and these are all ayat of the Quran, do not oppress him. And why is Allah subhanahu wa ta'ala talking about the orphan? Why is he talking about the one who asks? He is talking about these because these are things which are familiar with the patient, in this case of Rasulullah sallallahu alaihi wasallam, because he was an orphan. He understood and he understands what it means to be an orphan. He was somebody who was poor. He understands what it means to be a beggar, somebody who is in need. So Allah is using examples from his own life to be able to say, look, you are much better off than so many around you. You now to put into place an action plan that will take you and to bring you into a stage that you would like to become. And then he ends with these words, وَأَمَّا بِنِعْمَةِ رَبِّكَ فَحَدِّثْ. And as for the blessings of your Lord, proclaim it. And this is important for us. Because with the moment something goes wrong in our lives and in the lives of our patient, the first thing that often comes to people is that God does not like me anymore. Allah does not like me anymore. Allah has abandoned me. Allah has taken away all the good things from me. Everybody else seems to have good house, good cars, all of the luxuries of this world. But I don't seem to have anything. And here Allah is saying that reflect upon your own self, your own condition. And what do? Fahaddith. Proclaim it. And this is what we often term micro-affirmations. To be able to, when we say the words Subhanallah, Alhamdulillah, Allahu Akbar, these are not just words which are meant to be said on our fingers or on beads, as the case may be. But every time you mention any of these words, you need to become reflective. Reflect. If you say Alhamdulillah, if you say all praise and gratitude belongs to Allah, what does that mean? That is calling upon you to be able to reflect on something which Allah has given you. something that you need to praise Allah for, something you need to be thankful to Allah for. So you think about yourself, what has happened to me? I'm going to say Alhamdulillah. I'm in a covered place. I'm in a place where I'm safe from the elements. From all of, imagine so many people around us who don't have a place that they know where to go to tonight, who are destitute, who are out in the streets. We are thinking about ourselves here in this beautiful room. Think about our brothers and sisters, perhaps in Burma, perhaps in Palestine, perhaps in other parts of the world, even here within the UK, who may not have as much as us. Think about those who are in hospital beds. So there are so many things that we can become thankful for. But being thankful means that you understand what you need to be thankful for. These are not just empty words. So subhanallah, alhamdulillah, Allahu Akbar, these words that we use, these are powerful formulas. These are powerful micro-affirmations. But they can only, the power that they contain can only be derived as such when it is that we use them in the correct way. When we use them with force, when we use them in such a way that every time we say it, it draws us one step closer to Allah subhanahu wa ta'ala. It's as if I'm moving to Allah. And I say, Subhanallah, Alhamdulillah, Allahu Akbar. And every time I say these words, I'm making one step closer to Him. One step closer to Allah subhanahu wa ta'ala. And this is what it ought to bring. So this presentation, what I have described is really a model. I have described a model of a setting. We spoke about the early morning, the warmth which is there. We spoke about the calmness during the course of the night. This is a setting. When you are engaging with patients and when you are engaging with friends and colleagues that you have to provide some sort of help to, do not do it in busy places. Be careful about the place that you do things in, at the time that you choose to be able to engage with others. And it's about listening. Allah subhanahu wa ta'ala showed that He listened. He understood Rasulullah sallallahu alaihi wasallam. He understood what was going on in his mind. And this is the first thing about a therapist. A therapist is not someone who speaks first. The best therapist is the one whose lips are sealed and who listens. And very often, even as an orthopedic surgeon, there are many patients who come to me, not so that I can take care of a limb problem of theirs, but it's simply for them to be able to talk to me, to tell me what has happened from one year to the next. And then the last words before they leave would be, Doctor, make sure that I get an appointment for next year. I must see you again next year. Is there a problem? No, there's no problem, but I need to see you again next year, just to talk to you. And it's also about empathy. It's also about giving a sense of hope. Without hope, we would lose everything. Hope is the key. La taqnatu min rahmatillah, Allah tells us. Never despair of the mercy of Allah subhanahu wa ta'ala. Remind ourselves of that and remind others of that. It's also about self-reflection, as we saw, enabling people to see the barakah that Allah subhanahu wa ta'ala has given them, all the good things Allah has given them, that they are often forgotten or kept away from themselves. And it's also about empowerment, having an action plan in place and being proactive in doing things. I believe that when we begin to look at the Quran in this way, when we begin to look at it not just as words which are meant to be said and recited during the month of Ramadan, when we begin to see it as words which are powerful, which are live, which have formulas, which can change the course of our lives and the course of the lives of humanity, then the Quran will begin to be the shifa that it was meant to be, the rahmah that it was meant to be, and the huda it was meant to be. Assalamu alaikum wa rahmatullah.
Thank you, Dr. Mohammed, for delivering such an important presentation to us this evening. I would now like to invite Mr. Shoiab back onto the stage to come and speak to us about another important topic, which is how to deal with chronic pain from an Islamic perspective.
Assalamu alaikum. I'll try and make this as short as possible under Shaz's direction. Just bringing up the presentation. So as well as my work within the musculoskeletal field, I've also worked alongside pain consultants and GPs within the Bradford region. And in particular, within the last couple of years, I was asked by my colleagues within the trust and within the CCGs to see how we could try and help to tailor pain management, and in particular self-management of pain conditions like fibromyalgia to the South Asian population. And alongside with my colleagues, we've put together some tips and guides that we now use as routine clinical practice with patients in Bradford, and it's been adopted by a number of other pain centres across the UK, and we presented this work at the British Pain Society in the last 2 years. So within Islam, and in particular from a research point of view, it falls within the remit of culture, and that's one thing which is important to understand. So I'll just break that down first of all, and then why that is important, bringing that back to the context of clinical care and what we can do as clinicians or therapists, healthcare professionals, to help our patients manage long-term with their long-term pain condition. So culture can be defined as a set of values, beliefs, behaviours, and as that diagram shows, part of that is the medical perspective, and underneath that, religion, kind of food, clothing, all these things make up a person's culture. And this is where Islam fits into the notion of culture and how we can adapt medical care to become culturally responsive or culturally adaptive to a patient's care. But also the UK clinical guidelines and standards of proficiency, particularly from a physiotherapist and an occupational therapist point of view, have been laid out within the standards of proficiency, which set out the knowledge we should acquire as these professions. In particular, section 5.1, understand the requirement to adapt practice to meet the needs of different groups and individuals. And 5.2, be able to recognise the need to identify and take account of the physical, psychological, social, and importantly here, cultural needs of individuals and communities. And again, section 8 and section 13 go on to stipulate the knowledge we should acquire as part of being a physiotherapist and also occupational therapists. But also back in 2016, the Royal College of GPs, as part of the musculoskeletal clinical module, this study, they updated their stipulations, and in red here, this is about the psychological, physical, psychological, socio-economic and cultural dimensions of health. So this is actually giving us the platform to raise awareness amongst other healthcare professionals, not just within this room, but within other faiths and walks of life. And then lower down in the box, be aware of cultural differences in the expression of emotional distress and how this may present as pain and loss of function. And again, within an MSK, Orthopaedic and Pain management realm, this is where kind of my work has come about. And this slide really just helps to summarize all the concepts of culture. And I'll just give you a moment just to read and digest and reflect on this. And it's on the back of this research, my colleagues my non-Muslim colleagues approached me saying, how can we help the South Asian patients that we diagnose with fibromyalgia understand they have a long-term pain condition for which we as a GP or a surgeon can do no further to help them. There is no opioid, there is no painkiller, there is no operation we can do to remove their pain, yet patients come back and keep seeing us for help with their long-term pain condition. What can we do to help them understand and maybe accept there is a long-term pain condition for which there is no cure? So in terms of the stats, briefly, severe persistent pain is associated with an increased risk of mortality independent of socio-demographic factors. That's quite a harrowing statistic. An estimated 40 million people live with persistent pain in England alone. A quarter of these people stated that their pain had kept them from their usual activities, including missing more than 2 weeks off work in 3 months. Multiply that over 12 months, that's a considerable burden. So the actual definition of pain, I mean, we all help patients in pain, whether it's, or whatever form of pain it's in, but what is the actual definition of pain? And the International Association for the Study of Pain in 1994 stated it's a response which involves an emotional and a sensory, experience to actual tissue damage or potential tissue damage. And that's where the notion of fibromyalgia, ME and CFS come in, because there's no actual physical tissue damage that's injured every inch of their body, but it can be the nervous system's perception of threat that floods the body with pain. And they also go on to state within the definition that the definition of the word pain is learnt in early life experience. So how somebody is brought up and how somebody lives the earlier parts of their life may shape the way they perceive pain and express pain. And they're quite two important parts of pain: pain perception and pain expression. And the way I explain to patients is, this is not an optical illusion, by the way. The red circles here are exactly the same. The way I explain it to a patient is that pain is the red dot. From the start of the journey with the smallest square to the end process, we don't aim to change the pain. What we try and do is we try to increase the quality of life around the pain so you don't feel the pain as much, because you have other aspects to improve the quality of life, happiness and fulfillment. And through research, there's certain things we can do to help improve not just the quality of care provided, but the equity of care. So in this example, with the equality, we can maybe provide a patient with an interpreter. That's one way to level the playing field. But to go that step further is to have that cultural awareness to help improve that patient's care. And that's something really important when asked by maybe non-Muslim colleagues about how we can bridge the gaps in knowledge and care provided. Equality and equity are quite often very different things, and there's lots of things we can do to bridge that gap. And again, there's some research that was done in 2009 in Leicester by some GPs about what patients and what actually in primary care what was needed. And again, this is going back almost 10 years that they acknowledged there was a need to provide culturally adapted care, again, not just within the pain management setting. And even more recently, Cardiff, who's an anaesthetist and a Muslim in Malaysia, they set up a pain management program in Malaysia, and they flew out a team from London that helped set it up in Malaysia. But they also then culturally adapted it using Islamic themes of prayer, namaz, and family integrated it into the clinical setting. And this was one way they helped to culturally adapt clinical care that was used in the input pain team from St. Thomas's, and they culturally adapted it to the Islamic setting within Malaysia. And then even more recently, in 2013, in the Arthritis Research UK published an article, one of the largest studies looking at the cultural variation of pain expression in an area of Tower Hamlets in London. And again, this is a really interesting study for further reading. And even more recently, Maki et al. In 2014 looked at the pain and exploration of low back pain beliefs within an Arabic population in London and also Bahrain. And there were 4 themes that emerged. In particular, point 2 there, self-management strategies for low back pain. Patients were requesting how they could use their faith to help them long term. And this is something that has been maybe negated by maybe the standard approaches to healthcare so far, in particular in this context, pain management or physiotherapy even. Patients were requesting how can we use our faith to help us move forward. Once we accept we have a long-term pain condition for which maybe no paracetamol, no opioid, no steroid injection will touch, what can we do to help us move forwards? And again, one of the conclusions was religious coping mechanisms are not common in Western populations. So a lot of the research that has been produced on pain management has been done in non-Western populations, and therefore this work that she's done is now moving and shifting the focus on how we can help patients. And again, Burton and Shaw in 2015 conducted a literature review, and they found that one of the articles they produced in 2007, there were 4 themes here about patients that had religious views and had issues with medication use. And this is maybe not even patients that have a religious affiliation or not. These are some of the common themes that I encounter in my clinical practice. And it's really important to address some of these concerns patients have regarding that they've been afflicted with pain because they have done wrong or they have committed sin, and that's why they have maybe fibromyalgia or chronic fatigue. And maybe addressing some of these cultural connotations that patients ascribe to their pain. And also another pointer for further reading is Pain Concern, which is a really good pain management kind of a podcast website, and produce lots of podcasts on a monthly basis about expanding the biopsychosocial model to include spirituality. And that's a very, again, fascinating read about how we can incorporate that into clinical practice. And one fascinating textbook, Culture, Brain and Analgesia, 2 medical doctors from the US, an emergency department doctor and a primary care physician in America, have literally scoured the earth and how pain is managed in various cultures across the world, from the most remote islands of the world to the most urbanized parts of the world, and looked at how pain is perceived and also how pain is expressed. And again, they list how pain is perceived, how pain is expressed, and the various management strategies these patients and populations encounter in their daily routine practice. So how have we culturally adapted our practice in pain management? As well as the earlier leaflet about physiotherapy and Salah, the other leaflet on the other side is titled Taking Care of Your Health, Islam and Chronic Pain Information Leaflet for Muslim Patients. Again, both of these leaflets are freely available on the web link at the bottom of the slide. And these 2 leaflets I help work through with patients on a one-to-one basis when I see them, when they're first being diagnosed and they've been referred on from either the GP, MSK triage or pain management service. It really helps to set the tone for a patient that not all is lost. There is hope and there is a way forward. And that way forward may be using and tapping into our faith and religion to help us move forwards. But most importantly, a practical tip is acceptance. Because if a patient doesn't accept they have a long-term pain condition, that's setting up the patient for a very difficult and rocky road ahead. And trying to understand the patient's mood, how they feel, and if the mood is particularly low with whichever outcome measure you use, do they need to have onward referrals? Beliefs, what they think is their cause of pain. Do they think it's down to the cold weather, a curse, eating certain foods, bad blood? And these are all very common things I hear when patients have been diagnosed with different forms of long-term pain conditions, and managing expectations, which is key. And also, so as well as using those 2 leaflets, most often what we find is patients that develop a long-term pain condition over a number of months, years, become socially isolated, become physically deconditioned, and all often tackling the social isolation by integrating them back into their local community is often more paramount than physical exercise, relaxation. It's actually engaging them back within their local community to give them a sense of purpose again. And also we released a video that helped to break down to a patient about long-term pain self-management by a chap called Pete Moore. This video was translated into Urdu, which is available again on YouTube for free. And this is a very nice animated video that breaks the notion and concept of self-management into 12 very simple steps. And this work also won an award back in around 10 years ago with the leaflet that Muhammad Arshad, the Muslim chaplain, put together, and also 2 years ago when we compiled a comprehensive pain management program in Bradford. And quite luckily we also gained the recognition of the CQC, and it became an area of outstanding practice that was mentioned, commended by the inspector in the Bradford region with one of the GPs and the triage team that we work with. And this was quite a nice recognition of the work that we've been putting into helping patients bring Islam and culture into clinical practice. That's all. Thank you.
Thank you, Mr. Shoiab, for another very important talk. I would now like to invite Dr. Rashid back to the stage for a final talk on the medical and ethical issues which are relevant to our practice today as healthcare professionals.
Alhamdulillah wa kafa wa salatu ala ibadihi allazina istafa. Assalamu alaikum wa rahmatullah. Right, okay. This is the interesting part where we talk about certain fiqh masail. Now, there are a couple of questions that were put to me, and the idea was for me to give a kind of a response on a level where it would be easy for you guys to absorb the information. So what I'll do is I'll start off with the questions. Okay, so these are some of the questions. So the first question is, what options do you have if fasting and you have final exams or a long surgical list and you fear you may not focus as well? So the question here basically is on the basis of fasting and hardship. So if I just took it under the title of fasting and hardship, what's the Shari perspective to that? And I'll talk about it in a short while. The second question is, what should you do if you are going in to perform long surgery in the afternoon from Dhuhr until Maghrib? And can you combine your Dhuhr and Asr? So, Jama' bayna salatayn. So here the question arises, can you, as a muqim, as somebody who is clearly not traveling, you're at work, and can you combine your salah? And the third is, can you break salah if praying and there's a crash call? For those of you who are it's usually junior doctors, but I'm sure we have some sort of senior doctors here who also attend to emergency crash calls. So what's the take on that in terms of if you are in the middle of your salah? Right, so I'm going to do this very quickly, and I'm just going to give you the basic principles. Now, if you were to go through a number of books in fiqh, and especially if you go through all the madahib, all the different schools of thought, there are recurring themes that generally tend to occur, and I've called them the four-principle approach. Okay, and if you apply this, generally, it'll give you some kind of sense of understanding of how you should approach the subject of fasting and where it's excused. There are verses of the Holy Quran that relate to exceptions are made for those of us who are ill and who are basically traveling. But generally speaking, the four areas to think about, and this can be applied anywhere. It can be applied to diabetics, it can be applied to elderly people, etc. On that basis. So one is regarding worsening physical condition. So by fasting, whatever condition you have, medical condition, if it actually will become worse, okay? So in each one of these areas, there is a certain threshold, and I'll explain what the threshold is. And at this point, you will sort of make a decision and say, now is the time for us to say you are exempt. Okay, so from the perspective, from an Islamic perspective, if you were to talk to a certain mufti or a scholar, they will normally have differing thresholds, and what they would normally say to you is, go to a physician, ask them, and if they come back to you and say that it probably isn't a good idea, but they will also say tabib al-hadiq, so they'll say basically somebody who's an expert physician, who's a Muslim. Ideally, they're the ideal people. But I find that sometimes that's not always the case. Even non-Muslims can be quite sympathetic. The other is slower recovery. So by fasting, let's say, for example, you have a chest infection, you're not too unwell, but by fasting, you know that your condition could worsen. That's one thing. And the other thing is that your recovery may be slowed down. Again, there's a certain threshold at which point we will decide that now, at this point, it's ideal for you not to fast. The third is worsening mental conditions. So sometimes we don't acknowledge our mental state, just our physical, when it comes to fasting. But clearly there are many instances. I get approached quite a number of times. I get phone calls from all over the country, even abroad, where certain individuals ring me and contact me and ask me, a certain woman has, or a man has, a certain mental illness, and they are actually not too bad at the present moment. However, we're concerned that if they basically do not take their medication or whatever, the situation will be such that the mental illness may actually get worse. And the fourth, which we talked about in relation to pain, so worsening pain. So somebody's got a lower back pain, quite severe lower back pain, takes a number of different medications through the day to ensure that the pain is relieved. But clearly, if he starts fasting, that could be quite problematic. There are alternatives, so if there's other alternatives to pain management, such as patches and various other things, sometimes not easily available. But if there are, then you can resort to that. But generally speaking, if a person does fast, there is some anecdotal understanding that it does tend to increase your pain awareness. When you're fasting, you tend to be a bit more vulnerable. So, going back to that question regarding somebody who's got a long surgical list the next day, should they fast or break their fast or whatever. This is the main threshold point. So when they are unable to physically or mentally perform normal and important daily chores. So these are, what's your normal daily activity? And also what is important daily activity. So there's something that we just generally do as a leisure. There are certain things that we would do as normal, important daily activities, like go to the bathroom, use the toilet, and eat, walk to one place to another, use the kitchen, etc., those kind of things. So if it will have that kind of level of impact on you, that it will prevent you from doing those things, and if you apply those four sort of areas, worsening physical condition, slower recovery, worsening mental condition, worsening pain, to that extent that it has an impact on your daily activities, then those kind of individuals will be exempt from fasting. So if you go back to the question regarding the surgeon, I mean, there are alternatives that a surgeon should ideally use. For example, he could take annual leave during Ramadan if it has that much of an impact. He could have a good night's sleep before he goes into work. There are many ways that to sort of overcome that, and for that reason you'll find very few, if any, ulama who would basically give permission for a surgeon in that particular area to go ahead and not fast, especially in the month of Ramadan, which is compulsory to fast. Okay, well, hopefully, we'll talk about that. If there's any Q&A questions, we'll talk about that in more detail later on. The next thing is Salah. Now, this is a bit difficult. It's a very sort of a difficult way to answer this sometimes about joining your Salah, because the different schools of thought differ on this. And what I've done is don't sort of read too much into this, into the detail. The point of this slide is just to give you the level of possible detail that could exist within this. So on that basis, I'll describe the themes here. But there is something about combining Salah. Now, everybody, the Hanafi, the Maliki, Shafi, Hanbali, or these Sunni schools of thought, they all agree that when it comes to Salah, you can shorten your prayers. Okay, they all accept that. And in fact, it becomes mandatory that you shorten your prayers in certain schools of thought. However, when it comes to joining your prayers, there is a difference of opinion. Now, generally speaking, what that generally shows that if you look at the Hanafi fiqh, they say no. You cannot combine your prayers. Okay? And that's a very clear consensus from the Hanafi fiqh. The Maliki and the Shafi and the Hanbali say that you can combine your prayers. What it means by combining prayers is combining your Dhuhr with your Asr and your Maghrib with your Isha. Combining your Fajr with your Dhuhr is not permitted by any of the schools. Okay? And combining your Isha with your Fajr is not permitted by any of the schools. So it's just specifically to those two, your Dhuhr and your Asr and Maghrib. Okay. Now, so the Maliki and the Shafi and the Hanbali have a greater level of leniency, the Hanbali being the most lenient, the Hanafi being the most conservative on the issue of combining your Salah, even on travel. The question arises, which Salah, and it sort of gives a bit of an idea about which Salah there is, as you can see there. The interesting thing is, if you go through the books of fiqh, they do outline certain concessions where somebody is muqim. Now, we're talking not about a person who is a musafir, somebody who's traveling, but rather somebody who is not traveling now. Can they combine their prayer? So that's the question. So when looking at a particular surgeon who has a long surgical operation to perform, and in that situation, he's going to end up missing maybe his asr because he's already dhuhr, and he's basically just going to finish at the time of maghrib. What's the situation for him? Now, if you look at this sort of slide, you'll see there are certain terms that in here that I don't want to bog you down with, especially since we've got very limited time. But generally speaking, you will see that when you look, I'll explain some of the terms. So if you look at the Hanafi, and look where this says travel, there it says Jama' haqiqi. Okay, what that actually means is truly combining your prayers in such a way that you're reading one of the prayer, okay, maybe Asr, in a different time period to what has been determined for that particular prayer. So you're reading your Asr in your Dhuhr time. Okay, so that would basically be what we call a Jama' haqiqi, to combine in reality. Yeah. Now, what the Maliki and the Shafi Hanbali do is, if you look at their concept of other excuses, they say that it's preferable for you. There's a long debate, maybe sometime I'll talk in more detail about this. In limited time, I can't really go into too much detail. But the concept of Jama' taqdeem basically means that what you're doing is you're reading your Dhuhr and your Asr in your Dhuhr time. So the Malikis have an inclination towards that. The Shafi'is say that you do Jama' taqdeem, that you basically combine your Asr and your Dhuhr in your Dhuhr time. And they give their excuses. So they say ill health would be a reason why you could do that. They talk about heavy rain, but some of them differ on the basis that if it's heavy rain, what you do is it can only be done in Jama'ah, in the masajid, okay, not at home. So if you're munfarid, if you're on your own, reading on your Salah on your own, it's not permitted for you to do that. So you will see the general theme here is that all the schools of thought, okay, the Hanafi basically do not allow you to combine your prayers, full stop. Okay? The Maliki, Shafi, Hanbali allow you to do that when you're traveling. Okay? Then when it comes to other excuses where you are not traveling, on that basis, the Maliki, Shafi, Hanbali do allow you to combine your prayers, but they give their reasons and they give you where you are excused. So they make that be clear. In each one of those conditions, you will see that there is an element of mushaqqa, difficulty, hardship. Mushaqqa to tajlibul taysir. Mushaqqa can basically lead to ease from the Shari perspective. So on that basis, what they will do is they will, so if you were to talk to some of the other madahib, you will see that they would allow somebody who clearly is undergoing hardship to combine their salah according to Maliki, Shafi, and Hanbali, potentially, that they can do that. However, the Hanafis will not. And if you're a Hanafi from the Hanafi madhab, you've got a problem there. However, there is a little window period thing that you can actually traverse, and that is where there's two things you can do. You can do what we call a Jama' Suri, and Jama' Suri is basically what you do is you combine in essence, it's not really combining your prayers in different time periods. What you're doing is you're reading your Dhuhr at the latest time and you're reading your Asr at the earliest time. And you're combining it that way. And when you combine your prayer, what's really important for you to note is you cannot read your Sunnah Salah in between your two Faraid. Okay, that's a very important thing to understand. So if you read your Dhuhr Salah and then you read the Sunnah in between, that's not permitted. You have to read your Fard and then your next Fard, like that. So, from the Hanafi perspective, if they were really burdened and time was running out, it is better for them to combine their prayer, and they would have to end up doing such in the way that they are doing it towards the end of time in that instance. It's better for them to combine their prayer than it would be to miss their prayer. So if on a basis of necessity, let's say for example a surgeon is going into theatre, and he knows that when I go into theatre, I will not be able to get out of there by Maghrib Salah, I'm going to miss my Asr. And he follows the Hanafi school of thought. On that basis, if he has a level of certainty that that's the situation, then on that basis, out of necessity, he can do that, but he needs to refrain from doing something like that. He needs to make sure that this does not become a regular practice. It's very important. Individual cases, you need to discuss it with a mufti within your locality, wherever. But generally speaking, on that basis, there's an argument to be said regarding somebody who is combining their salah in all these cases, because all of them require an element of necessity to some degree for you to combine your salah as somebody who's not a traveler. So for somebody who's, and I was talking to a couple of surgeons regarding this, and they were saying, it's not really an issue, because, sometimes you have to use the toilet, you go off, you use the toilet, okay, you have to wash yourself and get back into your greens again. But generally speaking, that it's not, they've never really felt it was a problem. For those of you who clearly work in an environment where it's really problematic for you, then you need to basically talk to somebody who's qualified and discuss your personal case with them. But on general basis, you should avoid and try to plan your day in such a way that you can perform your salah in their prescribed times rather than not in their prescribed times. Now this slide I'm not going to go into detail in. This is just explaining the Hanafi stance on it and where it becomes permissible. There's priorities that you should try to do it in the Adha time, in its prescribed time. And then what you do is you try to do Jama Suri, where you try to combine the two salah together. Okay? End time of Dhuhr, beginning time of Asr. And then the next one is that if that's not possible and you're losing time and it's not possible to do anyway, then you should ideally do what we call Jama Ta'khir. And what that basically means that you read your Dhuhr and Asr at a later time, or Jama Taqdeem, where you do it at an earlier time. Okay, inshallah. So if there's any questions, I'm sure we can ask them in the Q&A. Jazakumullah khair. Assalamu alaikum.
Thank you, Dr. Rashid, for that very thought-provoking ethical discussion. We will now have a panel discussion which will be led by Dr. Zashan Ali, who is a core team member for BIMA Northwest and a GP from Manchester.
Assalamu alaikum, everyone. Jazakallah, brothers and sisters, for coming to this talk. This is the final session, which I'm sure you'll be relieved about. It's been quite informative discussion, and unfortunately there's been quite a lot of questions, so I've had to be quite selective and reduce the number of questions. So if anybody has any questions to ask, they can approach the members direct. So yeah, let's get started. If I can start with Dr. Rashid. My mother has dementia and type 2 diabetes and is 67 years old. I would like to get Hijama for her, but the GP says it's not recognized. What should I do? Hijama, the GP says it's not recognized form of treatment.
Okay, right. Now, clearly you need to look at the medical condition of the patient as well. So, there are instances, and most of the couples, what they tend to do is they do take a brief history in terms of certain medication that she may be taking and so forth. So, if they're taking, for example, anticoagulants, blood thinners, then there is a risk of bleeding, especially if they're doing wet cupping. So ideally, if she is going to do something like that, even if you do dry cupping, you're placing a vacuum there and you're really sucking on the skin. So potentially that could lead to some serious bruising as well. So you have to be very particular about the medication that she's taking. If she's frail, and I mean, sometimes you have instances where people are fasting and even for them to have their blood withdrawn, it becomes quite problematic. They feel very dizzy, feel very sick. So you need to really assess her frailty. If she is up to it, probably best or worthwhile even talking to a Muslim medical practitioner who has some kind of knowledge in this area, and talk to him on a personal basis. You need a lot more detail in terms of medical history to make that kind of decision in full honesty. Exactly.
Okay, the next question is for Dr. Rashid as well. What's the general consensus regarding signing cremation forms? The background was that they're a junior doctor. Can I refuse to sign them?
Okay, that's an interesting one, very controversial. I've had a number of ulama approach me about this for some of the viewpoints that I've stated earlier on. But generally speaking, the main thing is the concept here is about directness of intention and how direct the procedure is. And one of the dilemmas about cremation forms, get straight to the point, is the issue that the cremation form that you actually fill, if you actually read the cremation form, the cremation form very clearly states that it's a cremation form and it's used specifically for cremation purposes, okay? And because it's used specifically for cremation purposes, what you're doing is, whether you're not actually cremating anybody, nor you supporting the idea of cremating anyone, nor do you have the intention of cremating anybody, but you're just completing a form which is used solely for that particular reason, certain ulama have an issue with that, okay? And that's where the issue lies. And I think I did an earlier presentation in this very place about that there are instances where that would be permitted, especially when you look at the concept of the fact that we are minority Muslims in a non-Muslim country, where majority of people here are non-Muslim. And in that situation, it may be part of our role to cremate, or to fill in cremation forms. So I would say best to act on caution, okay, and try to abstain if possible. But if it requires that, there will be an element of hardship for you to refrain on that, because it's a private, filling cremation forms is a private role. It's not core work as part of your NHS. If you live in an area where there are many people who are getting cremated, then it becomes quite a considerable amount of your work, and that's where it becomes more hardship for you to avoid it. And in that case, there is that scope for you to be able to do them.
Okay, the next question is for Dr. Sharif. Are there certain rules needed to be followed as a Muslim plastic surgeon?
Say it again.
Are there certain rules that are needed to be followed as a Muslim plastic surgeon?
Jazakallah khair. I would be very surprised if you don't ask me this question, because every time I go to any meeting, if it's nothing to do with plastic surgery, always been asked this question. Okay, plastic surgery, probably maybe whoever's asked the question is meant cosmetic surgery. Cosmetic surgery doesn't even make not even 5% of plastic surgery. Plastic surgery is actually, it's a reconstructive, it's a burns, you do hand injuries, you do trauma, you do facial injuries, you do microsurgery. I don't do myself, I don't do private, by the way, so I don't do cosmetic surgery. But probably maybe Brother Rafaqat remembers, must be 10, 15 years ago since we attended ethical meetings for the ethical forums anyway, and we discussed this in details. Probably maybe need to, this is a big topic, discussing plastic surgery, what I mean, the cosmetic surgery in a term, is it halal or haram, and when it's allowed or not. There is, if somebody really would like, I'm happy to discuss, but it's a huge big topic, and there's so many considerations being done. But plastic surgery as such is a very great specialty, and we really need Muslim trainees and Muslim doctors really into this. Whether you can only practice in reconstructive, that's fine. This is quite easy anyway. You don't have to practice cosmetic surgery, which is, in fact, cosmetic surgery is not done in the NHS anymore now for the last probably 4 or 5 years now. You have to have exceptional case committee and funding, so it's not a problem.
Okay, the next question is also for Dr. Sharif, more in relation to the talk. Did Muslim physicians have non-Muslim physicians on their panel when they were selecting those physicians that were fit to practice in the golden medical age of Islam?
As I mentioned, one of the slides, in the Islamic civilizations, plenty of even non-Muslims, they contributed and they used to practice medicine, and they used to feel this is part of their practice, part of their life. They speak the same language. Muslims that time, they were really quite open, and mashallah, the practice of Islam as well, which is teach us to be quite open, quite tolerant, and this has been quite recognized. I didn't want to actually put too many slides, but there's plenty of quotations on the practice of Muslims and non-Muslims in the golden era of Muslim civilizations, which has been published recently over the last 10, 20 years, and how tolerant was Muslims towards others that time.
Okay, Jazakallah. Next question for Dr. Younis. Can you fast with type 2 diabetes and being insulin dependent?
Yes, you can fast with type 2 diabetes with insulin. What's important is to have some sort of education to look at adjusting your insulin before you fast. So sometimes we will need to look at reducing insulin, sometimes changing the timing of the insulin treatments. We have better insulins than we had 10, 15 years ago, so it's much more important. There are certain individuals who have type 2 diabetes on insulin treatment who may be at very high risk of having fasting, and those are the individuals perhaps who shouldn't be fasting. So it's important to see your general practitioner, your physician, your specialist, to seek advice on this specific issue.
Okay, Jazakallah. And another interesting question for Dr. Younis. Are artificial sweeteners good for you?
Yeah, good question. The advantage and disadvantage of artificial sweeteners is that it's better than sugar. The disadvantage of artificial sweeteners is that they add taste, and therefore they make you feel hungry, and therefore overall they tend to increase weight by making you feel more thirsty, making you feel more taste for sugary things. So there's two schools of thoughts about artificial sweeteners, but they're probably better than having sugar. So, for example, if you drink sugary drinks, you know, that's high in calorific intake, whereas artificial sweeteners, generally there's very little calories. There's no calories in drinks, fizzy drinks containing artificial sweeteners. But the way that these medicines work, or the way that artificial sweeteners work, is that they have a stimulation for taste, and that makes you feel hungry, so you tend to put more weight on individuals. So if anything, you can try and avoid these. It's probably the best practice.
Okay, Jazakallah. Next question is for Mr. Shoiab. What do you think about alternative remedies to manage pain, i.e. turmeric, curcumins, haldi, and South Asian culture?
Yeah, I mean, my mainstay of patients is helping patients with long-term pain conditions. Often many of them come asking what my own personal viewpoints are on alternative therapies and like cupping. And I often say if it's helpful, then continue with it. If you've tried it, several times and found no benefit, then maybe try another alternative. I don't like to kind of maybe put patients off in their own kind of search for remedies when they've tried the traditional medical techniques. I often say, well, if you wish to use turmeric and you found benefit from it, if you can clearly state to me that you're finding benefit from that, then continue, because the side effects from that are maybe not as significant. And if they're saying to me that they're going to use a technique that's going to maybe bring them harm, then I'll maybe not recommend it. So it's kind of weighing up the risk-benefit ratio of what they're suggesting to me.
Okay, Jazakallah. The next question is also for Mr. Shoiab. You mentioned in your talk that Salah is a form of exercise, but the recommended exercise regimen is 150 minutes of weekly moderate activity, referring to exercising at a moderate intensity, which means the heart rate should be at 60% maximum. But when you do Salah, it shouldn't be this fast. So how do we address this issue?
So often for a patient that is significantly deconditioned and they're struggling to engage in exercise, as a starting point, you need to be able to walk before you run. So as a way of starting off, maybe using the Salah as a gentle form of exercise to help them through the idea of graded exposure to begin to exercise. And once they've built up that tolerance, that they can tolerate standing for 2 or 3 minutes, they can tolerate the lumbar flexion, they can tolerate sitting on flexed knees. That's often the starting point. And then from that, they can combine that with other forms of exercise in the home, outside the home, in the local community centres, maybe the exercise regime that's the physio that they're seeing has prescribed them. So Salah kind of maybe is the starting point, and then from there the patient can begin to build up their strength and conditioning regime from there.
Okay, Jazakallah. Next question is for Dr. Mohammed. How often should we recite Surah Doha to manage a depression on a weekly basis or on a monthly basis?
The simple answer to that is that you recite it as often as you would like. And it's not just Surah Duha, there are so many other ayat of the Quran which can be used. And it's for you to be able to begin to explore the Quran. The Quran is a remarkable book in the sense that it does different things to different people and different ayat. And sometimes you read the same ayah on one day and it doesn't have the same effect as you do on another day. And that's because you bring to it time, place, the context, your own situation, what's happening with you, your own mental, your state at that point in time when you engage with the text. So it's important to be able to look at the Quran over, and if there are particular surahs which you would prefer to read and it does help, by all means read it as often as you like.
Surah Yasin, that's a good surah for anxiety.
The entire Quran is good. The important thing is that it's not just about the anxiety which ought to be looking at and addressing. At the end of the day, the primary purpose of the Quran is for you to draw closer to Allah subhanahu wa ta'ala. And sometimes this is a means towards an end. Even sometimes, a disease might overcome you. It's a means towards an end to be able to recognize who the real healer is.
Okay, Jazakallah. The final question is also for Dr. Mohammed, and that is, what's your perspective about people who recite ayahs of the Quran and then blow this into water and give us shifa?
I think blowing things into water, I think we need to again go back to the point I just made about the Quran being a guidance to humanity. That's where the real benefit of the Quran will come from. Blowing things in water using magical formulas, one always has to go back and look at the basis for this type of practice. And you would find in many instances that these practices do not have any authentic basis from the Quran and Sunnah.
Okay, Jazakallah everybody. That concludes the question session. If I can now introduce Dr. Malik to conclude.
Jazakallah for that very informative discussion. We would now like to invite Dr. Shahzad Amin, who is a GP in Manchester and the regional lead for BIMA Northwest, to come and present gifts to our guest speakers as a token of our appreciation for taking their time to travel here today and deliver this seminar. This will be followed by a few closing remarks for the seminar, inshallah.
Assalamu alaikum wa rahmatullahi wa barakatuh. I'm only going to speak for 1 or 2 minutes, hopefully keeping it very brief. I'd first like to thank everyone for attending today on this cold winter day. And I hope everyone has learned something and benefited from these sessions today. And hopefully this can be passed on to others as well. A special thank you to our guest speakers who have delivered excellent talks on the different respective subjects and taking time out to attend here despite them being very busy and some of them having to travel from quite far. I'd like to thank all of our volunteers for all their help in preparation for this event, and to our sponsors, Silverdale Solicitors and Communities for All, and last but not least, the wonderful team at Werner Suite, who've been fantastic in setting up this venue. I just want to talk briefly for a minute or two just about some of the upcoming events that we have planned for the region. So Brother Waqas mentioned quite a few things that we're doing at the moment, but I just want to talk about something we've got planned. So from the health promotional aspect, we have quite a few talks planned for the rest of for the next year. We're working with Cancer Research UK to deliver talks around cancer screening in January. This will be followed, and this is going to be across multiple centres in the region, mosques, so hopefully if anyone's interested, do make contact with us. In April, around safer fasting in Ramadan with diabetes, and then in July around depression. So these again talks that will be delivered at numerous centres. We'll also be having the Lifesavers, the annual Lifesavers event, and Sister Amna will touch on this just after I finish off. Some of our mosques, we're doing some piloting of some works such as free health checks. So this is for the local congregation. So one of our mosque free health checks, signposting on mental health conditions. So again, these are things that we want to roll out across other mosques and community centres. So again, if people are interested, volunteers, please do come forward. We have webinars planned, and we'll be kickstarting this in January, inshallah, on the 21st of January. Dr. Riza, one of our speakers today, he'll be speaking, and this will be on a Sunday, 11 till 12 in the morning, and it will be on the topic of health guidelines from the Quran and Sunnah, a lost treasure, and how Muslim healthcare professionals can benefit from them today. And hopefully these are monthly seminars that we'll be having, webinars with different speakers every month. We have ethics teams in BIMA, again a national project, and again this is something that if people are interested, there's lots of literature they've produced, posters they've produced, and these are things that you can hopefully get more information on. CPD projects planned, again this is for healthcare professionals, these are planned for later in the year, and this is more of a national project. We have doctors training courses in the region, and again these are planned for new foundation doctors, trainee doctors, not sure which part of medicine to continue their career in. We're currently recruiting for our Halal Vegetarian BNF project, and this is a project where we hope to work with our allied healthcare professionals and produce a halal and a vegetarian version. So this is for non-Muslims and Muslims who can benefit, patients and healthcare professionals. Lots more that we're doing. I haven't got time to go through everything, but everything's on our website. Follow us on social media. You can register your interest. Our brothers and sisters are at the back. We're working with not just medics and medical students, also allied healthcare professionals. So that can include doctors, dentists, pharmacists, podiatrists, psychologists, anyone that wants to work with us. Be part of this BIMA umbrella. Please join us and work with us. I wish everyone a safe journey home. There'll be refreshments at the back, inshallah, and I'll just like to invite Sister Amna just to come and say final few words. Jazakumullah khairan.
Jazakallah, Dr. Shahzad. Unfortunately, because we are running 25 minutes late, we will have a short 10-minute break. Please, you can collect your food at the back and bring it back to the table. We'll be beginning the Lifesavers Awards presentation right away, where we'll highlight some of the achievements of the project over the last few years and then present some awards to the most outstanding volunteers and mosque leads across the region. For those of you who aren't able to stay for the Lifesavers presentation, Jazakallah khair for attending today, despite the poor weather conditions and on a Saturday evening. And have a safe journey back, inshallah. Jazakallah. Okay. Assalamu alaikum, everyone. Can we please get seated for the Lifesavers Awards presentation, please? Should we start? Should I give them two? Just start. Okay. Okay. I hope you've enjoyed the refreshments and had an opportunity to take a small break and network with other people in the team. We will now begin the Lifesavers presentation. Dr. Shanaz, who is the regional Northwest Lifesavers co-lead with myself, will be presenting today. She's a GP based in Oldham, and she's also a core team member for BIMA Northwest.
Assalamu alaikum, everybody. Can I have a show of hands of anybody who was a mosque lead? Is any mosque leads here? And any volunteers at the mosques? Oh, Jazakallah. So first of all, I'd like to welcome you to the BIMA Northwest and Yorkshire. This is a combined Lifesavers event. And a big thank you, Jazakallah, to all of those here and those also who are not here. Any organisation is just as good as the people who are in it, because it takes a lot of dedication, sacrifice and hard work. So that's kind of the recipe for success. And of course, there's always that sprinkle of good intention and du'as which help lead to success. And the success of this year's BIMA Lifesavers project 2017 was due to each and every one of you who took part in it. So what I'd like to say is, may Allah reward you with a very beautiful gift in this life and the next life. And if you can all stretch over and give yourselves a pat on the back, because you really deserve it. Well done, everybody, for that. Now, BIMA Lifesavers is a way that we can bring the mosque to the centre of everything, not just prayers, a place for learning, but it's also bringing everybody back, everybody in the community back to the mosque. And as we know, that 80% of arrests occur at home, and the survival rate is 8%. But with CPR training, survival rises to 25%. So simple ABCD saves lives, and it's early recognition and basic ABCD which does that. So that's why this project is vital. And you've taken part in this project, so Jazakallah for that. You are helping to save lives. Now, does anybody know how many mosques took part in this year's BIMA Lifesaver training? Anybody want to guess how many mosques? Is it 50? Anybody else? It's like a little auction here. 100? Okay. So what about how many volunteers? Does anybody have an idea of how many volunteers we had for this year? Any idea? Nobody, okay. And what? 200. Okay, somebody said 200. And how many people did we actually train in CPR? Any ideas? Anybody want to guess how many people we've actually trained this year for the BIMA Lifesavers? 500. Anybody else? 6,000? 600, right? 600. So 40 cities took part. Here are the answers, I think. Oh. Yeah. So 70 mosques took part, more than 600 volunteers, and there were 3,500 participants. So it was amazing, mashallah, wasn't it? It's incredible. From 40 cities. And in the Quran, in Surah 5, we're told that if we save one life, it's as if we saved the whole of humanity. Now, everybody knows that special day. If you think back in time, Saturday, 30th of September, was National BIMA Lifesavers Day. So all through these cities, 40 cities, on that single day, on the 30th of September, we had the Lifesaver Training Day. Would anybody here like to share their experience of how they felt when they're doing the training? I don't want to pick anybody from the audience, but I might have to. Sadia, do you want to tell us how you felt? That's so kind of you to come up. So, were you a volunteer or were you a mosque lead?
I was volunteer.
And which mosques were you a volunteer
It was
for?
in Community Hof End in Manchester.
Yes, and how did you feel when you were training those people?
It is excellent because the people came from different community. I'm from Bosnia, so that is the first thing probably involve Bosnian people. And also because community like, you know, the multicultural and the Arab people also came. That is new things.
And so were you glad that you took part in it?
It is, because very, how can I say? Because I'm not a medical person, so it was really useful for everyone.
Yes, well,
So,
thank you for coming up.
Thank you for supporting us.
Now, can I just mention that on that day, I remember that when I was doing the training, I felt really good about that, because sometimes when you do good, you actually feel really good yourself. So that's a really nice way of doing good, gaining reward, and helping other people. So I want to encourage everybody for next year to join. Now, even though the event took place on the 30th of September, the BIMA project team have been working since March. And that is, they had to recruit, mobilize teams, and get all the paperwork done, the training day done. And the national team have been quite busy. And there have been some changes in the BIMA Lifesaver training in 2017. One of those changes was that we changed it from a national training to a regional training day, and also we had regional mosque leads. Also, we had the online training. I don't know if anybody found that useful. Online training, those who could not be there at the regional training day. Did anybody find that useful? We had the BIMA posters in 3 different languages. And also we have the dinner tonight, the awards dinner, which is in our regions, not in London, as it was last year. We also had the WhatsApp groups, which is new, regional WhatsApp groups. And the MCB helped us because they encouraged the mosques throughout the nation to mention the Lifesaver training on the Juma before. And we also had a hotline. I don't know if anybody knows about the hotline for the BIMA training. And the BIMA Lifesaver Day, there was a hotline. Yeah. So we do have a structure. I'll just quickly go through it. There's a national team, and the national team, the director of the national team, who was the inspiration for this project, was Dr. Wajid. Then the national team lead was Adila. Then there was a core national team, and they were responsible for your kit deliveries and your collection points and the publicity. Then we have the regional leads, such as Amina, she's been the Northwest Regional Lead, for example. And then we had the mosque leads. Some of you mosque leads are here, and thank you very much for that. And then there's the volunteers. And if you can see all these different names here, they're the different main leaders. And Jazakallah to every single one of them, because they showed a lot of dedication and put a lot of extra time, day and night sometimes, working on the project since March, which is quite a commitment. And the regional leads, I'll just say thank you to Amina. And I don't know if Dr. Mohammed Madassar Shafiq is here for Yorkshire North East. Anyway, Jazakallah to him anyway. Thank you. So let's go through the feedback now. So in 2014, when we started the project, there were only 3 mosques involved, and every year it's been doubling, and now, in 2017, there are 70 mosques involved. So mashallah, that's a great contribution there. Now, does everybody remember the 4-step technique? Does anybody want to remember the 4-step technique? Because that's what we had to do at the regional training days. These are the mosques who are involved in all the different regions. So many mosques involved there, 70. The regional training days were new for 2017, and the training of the 4-step technique, I'll just tell you that my family are a little bit fed up of me because I used to eat, sleep, and constantly talk about the 4-step technique of how to save a life. But the feedback from the regional training days was that everybody was very happy that they had the training in their region, and they found the WhatsApp groups very helpful. Now, if you go through the feedback forms, because that's what this event is about, really just letting you know about how things went. We had the participant feedback forms and the volunteer feedback forms. So here's the feedback. There were 69 mosques who handed their data back to us, and we told over 3,500 people life-saving. And of those people, 2,500 forms were returned, and of the 600 volunteers, 450 feedback forms were returned. So, for the participants, it's about an equally split, 50-50 split for females and males. And for the ages, mostly, it'll be in the grey colour, if you see it in the grey, mostly people were between the ages of 25 and 45 who learned BLS, and the under 18s as well are highly represented there, 22% were under 18. Oops. Ethnicity, mostly, if you look at the grey colour, Asian, there's mostly Asians represented in the participants, and also Arab were 10% in the participants. And the languages for the posters, the languages this year that we used for the posters were in Urdu, Arabic, and Bengali. And the feedback we had on the participation form was that 16% of people wanted it to be in a different language, mostly in Urdu and Arabic. So that's that one. So on the participant form, 31% of people said they had taken part in BLS experience before, and a quarter of them had had experience in the past year. And on the confidence in BLS, majority of people who took part and learned the BLS from us were very confident to do BLS after the training they received, which is very good feedback indeed. And for the instructor training, majority of people were happy with the training and they rated it as excellent. So well done all the trainers. Also, the volunteer feedback. Oops. Here it is here, the volunteer feedback. So after the regional training days and the online training, 98% of the volunteers said they were ready to do the training. And the improvements that the volunteers suggested was have more volunteers, more publicity, and more training. So some people actually wanted more training. And 100% of the volunteers said they would help next year. So I'm hoping that everybody here is going to sign up for next year. Hands up those who are going to sign up for next year. Because 100% of people said they would, so I'm sure. Oh, that's all of you here. So who were the volunteers that took part? You might be pleased to know that a lot of the volunteers, 42%, were medical students. And I think I'm very proud of the medical students, actually, because they really helped with this BLS training event. And a quarter of people who took part, of the volunteers for training, they were from a non-medical background. So these are the trainers. A quarter were from a non-medical background. There's some photos of the trainers. So going on to the mosque information, there's a bit of feedback there. I'll just mention that in the Northwest, 13 mosques took part. There were 118 volunteers and also 612 participants. And in Yorkshire, anybody from Yorkshire here? Anybody, Yorkshire? Anyway, there were 6 mosques there and 62 volunteers and 267 participants. So well done to Northwest. Well done to everybody, but no, this is the event for Yorkshire and the Northwest. That's Scotland, if you're interested in this, the last 2 columns, post-event confidence, effective instructor training. It's out of 5, so you'll see that everybody scores between 4 and 5 on the ratings. So Scotland's done very well. Yorkshire, North East, if you look at the last 2 columns there, you'll see they've done very well. I'll just mention Dohat Mosque in Bradford have done very well indeed. Bilal at Jamia Mosque in Newcastle, and a mosque close to my own heart because I am from Newcastle, though I don't sound like it. Central Mosque in Newcastle did very, very well. So well done, mashallah. And in the Northwest, the mosques that have done very well, everybody's done really well. If you look at the grades on the last 2 columns, post-event confidence and effective trainer instructor rating, they're between 4 and 5. But I'd like to mention in particular Al-Falah Mosque, very high ratings on that mosque, Nelson Mosque, Central Mosque in Victoria Park in Manchester, which was run mostly by medical students, the Heritage Centre, Al-Rahma Mosque in Liverpool, which had 100% on their training information, and they're run by medical students as well, and Abdullah Quilliam Mosque, another mosque which was mostly run by medical students, so the medical students are doing really well. This is East Midlands, if you're interested in how they did, and you can compare. They've done very well again. This one, West Midlands. Wales. London, obviously they had the most mosques. They had good ratings. We had some publicity, which I'm going to mention later. We were mentioned in a few articles. There's some articles there, and I'll read the feedback out in a minute. So we're here for the regional awards. I'll come back to that picture. So BIMA Lifesavers event from 2014, where 3 mosques took part, and now 2017, where 70 mosques, an outstanding 70 mosques, and over 3,500 people have been trained in BLS. What we've been able to do with this project is that we've united Muslims. Mosques have been given a positive image, and we've also given Muslims a positive image, which is nice because we get such a bashing sometimes. We've inspired Muslims in the UK, and also I've heard that some people abroad want to do the lifesaver training. So if you join up next day, you never know, you might get a trip abroad. I'm not promising. So we've also saved lives. We've not had any feedback yet, but inshallah we have saved lives. And we've also, the people who've been doing the training, they have pleased Allah because, as we mentioned before, saving one life is like saving the whole of humanity. And such a selfless act of giving up your time, the devotion, dedication of the training, that is a very great thing. And inshallah, Allah's very pleased with all of you for that. Special thanks to the MCB, Islamic Relief, for supporting us, and the British Heart Foundation because they did loan the kits out, and to every single one of you who took part in the Lifesavers training. So anybody ready for next year? Yay! So just sign up at the bima.org.uk website, please, if you'd like to do it now. Then I know that you've done it, and I will be checking your phones later. Just a joke there. So I'd like to read out some positive feedback that we've been having. So, this is from 2017. Haroon Khan, Secretary General of the Muslim Council of Britain, said, "This is a great initiative which allows mosques and Islamic centres up and down the country to not just serve as a place of worship, but to be service providers for all communities, to learn life-saving skills together through interfaith initiatives really captures the essence of unity, where communities can learn and come together to save lives. BIMA Lifesavers is on track to become the largest free accredited national basic life support training program in the country and is looking to help Britain become a nation of lifesavers." So that's the MCB. And also from the British Heart Foundation, in 2016, the British Heart Foundation said, "Wow, 1,500 people trained is brilliant. I hope you're really pleased. I'm delighted to see how many volunteers were keen to get involved and hope that people really feel like they've learned a life-saving skill. Great to hear that feedback from trainees has been positive too. If you do a write-up of the day, we'd love to see it. It's an interesting model for teaching CPR to a large number of people, and we'd be keen to share it." So that's from the British Heart Foundation. And from this year, we had an email from the British Heart Foundation. They said, "We're delighted to see the summary you've kindly sent through. 3,500 plus participants is a fantastic number trained. You certainly went bigger and better this year, and lovely to see the number of volunteers helping to engage so many in local communities. You must all be very proud of such an achievement." So that's some information from the British Heart Foundation. So well done, everybody. So now we're going to get on with the award ceremony. Oh. Amina?
Thank you, Dr. Shanaz, for that update. We will now present the Lifesavers Awards for the most outstanding mosque leads and volunteers in the Northwest region. Unfortunately, I don't think the Yorkshire volunteers are here today, so we won't be presenting those awards. As you have seen from the presentation, a significant amount of time and dedication has been put into the Lifesavers project by all volunteers. It has therefore been a very difficult decision in choosing the winners. Firstly, we would like to thank Rehan Munawwar for his outstanding contribution to the Northwest Lifesavers regional team. He was a major help in organizing the training day as well as the various mosque teams across the region. Unfortunately, he isn't here with us today, but we will get his certificate to him later on, inshallah. We have picked a single outstanding volunteer who has engaged very well throughout the process and was very proactive in organizing the event day with his mosque lead. Please can we congratulate Brother Zain Iqbal for his achievement at Kisra Mosque. I think his parents are here today to collect the award.
Say it a bit louder.
No.
What's the name? Are they coming? Is that him?
No, they're not. Okay.
Is that his parents there? Is that his dad?
Are they?
And if you could hold it up, maybe. Mashallah, well done.
Okay. In terms of mosque leads, we have picked one outstanding mosque lead and 2 runner-ups for the Northwest region. Our runner-ups have both been very proactive and highly enthusiastic throughout the last few months. They attended our regional training day and asked questions throughout when needed. I would like to congratulate Dr. Miriam Khan, who led at Abrar Academy in Preston, and Dr. Saif Riaz, who held the event at Heritage Centre in Manchester. Yeah. Please, can you come up?
Have your picture done, oh brother?
No, probably not. Sorry. Okay. Our first place prize goes to someone who, despite her busy schedule, has taken the time to engage with the core team throughout the last few months. As a medical student in her year of final exam, she has managed to impress by successfully leading the event at 2 mosques on a single day event. Thank you for all of your hard work, Hafsa, and congratulations on being the most outstanding mosque lead in the Northwest. So although not everyone has received a formal prize today, we would like to congratulate everyone for all their hard work in the Lifesavers Project 2017. It would be great if you could all get involved again next year and sign up online on the BIMA website. It would be great if you could all be a part of the project growing both nationally and internationally in the following years. May Allah subhanahu wa ta'ala reward you all for your efforts. That closes the event for today. Jazakallah khair everyone for... If there are any other mosque leads or volunteers, we do have some other prizes here.
Can you come to the front?
If you could come to the front, if there are any other mosque leads or volunteers from this year. No.
Anybody? Is that a Muslim?
I don't know. Okay. Okay, so that closes the event for today. Jazakallah khair for everyone for attending today. Please make sure you complete the feedback forms at your tables and return them. And please have a safe journey home, inshallah.
Also, Jazakallah to Amina for being the Northwest Regional Lead.
Oh, thank you.
What an outstanding job. You've done an outstanding job.
And you too,
Jazakallah everybody for coming. That concludes the event.
I don't think it's on. Yeah, it's not. It's not. You should take it. You take it.